All right, we're live. Awesome. Okay, so thank you for being here.
Thank you for having me.
You came in how long ago?
I think it was last week.
It's only been a week, huh?
Yeah, it's only
Put it
been
on
about
mute.
a week. About a week and a half, I think it was.
Okay.
Yeah.
So, for those who don't know, I'm Dr. Hendricks. This is Maria. 2 days ago. So we're basically at that point where we're going to talk and go through smile design and go through consents and just go through the works so that you feel as comfortable as possible come surgery day. First of all, do we have a surgery day already set up? Monday.
Yeah.
Nice. Awesome.
Yeah, we went from.
That is.
And she was messaging us on our live surgery, so I called her first.
That's
Yeah.
awesome. Awesome.
I got lucky. I would have never expected it to be that quick. So I'm super excited.
Well, cool. Well, I appreciate you being willing to be on here. I get nervous every time I go live, and so if you feel nervous at all, just know you're in good company with me. So.
Just a little bit.
Just a little bit. Okay, so one of the big questions I always like to ask people is, what is the biggest reason that you decided to come see me, and why are you wanting to do all this with your mouth, your teeth?
So, I've been struggling with my teeth for a while now. I wasn't taking care of my teeth a while back. It was a hard time in my life, and
Really?
Yeah, I was struggling with addiction. I was me to be homeless. When you're homeless, you don't have access to, health insurance or anything that, there's times when it's even hard to just find a place to go and brush your teeth.
Yeah, I can't fathom.
I already had some issues, especially because I'm horrified of a dentist, but that didn't help, and I thought I'd be okay. It was okay back then, but these last couple of years, now that I'm doing well and I'm doing a lot healthier, my teeth aren't doing too great. They started to fall apart. They started to break. I've had my 7 teeth in the back taken out because they were just hurting all the time. About 2 years ago, my 2 front teeth started to break and chip. And that's kind of where I started to struggle, with my appearance, with my self-esteem. I don't take pictures anymore. It's such a struggle to find stuff to eat. There's a lot of things that I used to like that I can't eat anymore. That's one main issue. Another main issue is just the constant pain. It's not excruciating pain all the time, but it's every day you're uncomfortable. Every day, if it doesn't hurt here, it hurts here. Sometimes it hurts way down, like just everywhere. And I always thought something like this would be out of my reach. I thought it'd be impossible.
People always say that, like they think they're never gonna have a chance.
Like
they have to sell a kidney, or they have to sell their, their house or whatever. But things kind of came together for you.
It really did. I have a friend of mine. His name's Mark. He really helped in all this. He's been a great support system. Without him, I don't think I would have been able to. It's just I had reviewed a couple other places as well, but what I liked about here is that you're so detail oriented.
Yeah.
You don't just pay attention to, we're just going to give you a pair of teeth and then that's it. I was watching your video on YouTube when you did the transformation for a gentleman. I think his name was Dave.
Mm-hmm.
And you were talking about like where your chin is too high up and we're going to, make it go down a little bit and it's going to change your face structure. And it's those little things that really caught my attention here. You're really looking at all of it, not just here's just a pair of teeth, have fun, and it's those little things that I've been seeing you do, like in your reviews and your videos and stuff, that you really take your time to get to know that patient, get to know what we like, what we don't like, how we live our life, to see how that matches with our smile.
Yeah.
For me, I want to say, not being able to eat what I want, not being able to smile, not being able to be confident in myself. You know, when I was younger, I used to have people always mention, you have such a pretty smile, you know, and obviously not anymore. And it's just changed in me a lot, you know. When I told my oldest daughter about me having this procedure done, she told me something I wasn't aware of before. I was actually telling Blake about it too. This is my oldest daughter, so she lives in California. So I only get to see them maybe once or twice a year. So, you know, my daughter being younger, she loves pictures. I don't, you know, and when I do, you know, and I'm going to oblige to what she wants, you know, I'll take a picture here and there. But she was telling me, you know, oh my God, Mom, now that you're gonna have your smile, now you won't tell me you're not gonna take pictures anymore, you know, and they're gonna be coming down in April, and she's already making all these plans of all these pictures we're gonna take and all these things that we're gonna do because now I'm willing to do it, you know. And she was telling me, you're not going to look so sad no more. You're going to smile and you're going to take pictures, and I can have them on Instagram and you're not going to say no. And I didn't notice it was affecting her like that. You know, I know it doesn't seem like a lot to maybe other people that don't understand that aspect of it, but it doesn't just affect like me. You know, that really made me realize it wasn't just affecting me. It was affecting also my kids, because they're seeing a side of their mom that they're not used to, you know.
Yeah.
They always wonder why I always look like I'm upset, or I look like I'm sad, or even when I take pictures, I don't really smile. That's if I even let them take the picture, you know. And they're just anxious to be able to see Mom smile, you know.
Yeah.
And it's been a long time coming.
Well, honestly, I'm just honored, and I feel so grateful that you came and you found us. And I always tell people that I always believe that like I attract people into my life, and good or bad,
Yeah.
usually good, but I attract people into my life. And so at the end of the day, I want to be around people that I like, and we hit it off right from the beginning.
Right.
And
Yeah.
let's remember, we hit the red button on each of them. They record. I just realized that I didn't. We hit it off because you hit on some things that I think that I really appreciate you telling me about, because it's part of the treatment, which is in the past you had some speed bumps in your life that we'll call them speed bumps, where you had some
Big speed bumps.
you had some problems with the addiction, and it ended up taking you down a pathway that was not good, but ultimately you were able to get clean.
Yeah.
And you've been clean how long?
It's been going on 5 years now.
And to me, like, I always want to honor you, because there are so many people out there that are wondering, can I do this? They're actually actively still struggling with addiction. I mean, especially with everything happening, but you did it, and you've been 5 years clean. And I just think that I want to honor you for that. But every time you look in the mirror, you're reminded of that past life, which you don't even associate with now, right?
So, you know, actually, that was, I think we kind of hit on that the first day I was talking with you. It was deep down inside, I had that, and it didn't really hit me till the day that I was talking to you about everything. You know, every time I look in the mirror and I happen to smile, or I look at my teeth or something, even though it's not directly a result of what I was going through, it kind of had to do with it, but not directly. But it just reminds me of that time. It reminds me, you know, every time I smile, this is the one thing that's left.
Yes.
That reminds me of that old Maria. You know, I've been able to take care of everything else. You know, I have my kids with me. I have reconnected with my kids. I'm a grandma now. I have grandchildren. Yeah, you know, and had I stayed in that path I was on, I wouldn't have what I have now. You know, the work that I do, the connection, the relationship with my kids and everything. I've been able to, like, unless I tell you, a lot of people would never guess that I've gone through that.
Yes.
You know, so maybe the outside doesn't know, but I know. And a lot of times I'd like to just forget, you know. But when I look in the mirror and I see that, it just brings me right back to that. And for a while there, I almost felt like I deserved it. I deserved to have this flaw that I have that really affects me. You know, I don't want to sound superficial, but it's my smile. It's our smile. That's one of the first things that people see when they come in contact with us. And for the longest time, I felt like this is what I get because of those mistakes that I've made, you know. And for a while there, I felt like I didn't deserve to get it changed.
Yeah, you talked a lot about that.
You know, but with the reassurance and the support of my kids, you know, like, Mom, you do. This is that last step that you're going to take to completely get over that and forget about it. And you won't have to look in the mirror and remember that.
Yes.
If you don't want to bring it up, you don't have to.
Mm-hmm.
You know, this is a start. It's a whole new start.
Because the cool thing is that if you bring it up in the future, it'll be because you want to talk about it, because you want to help someone, because you want to pay it forward. Because it sounds like there's been some really pivotal people in your life that have helped you. And part of this whole journey right now, being here right now, like, you didn't think you were going to be here a year ago, right?
Oh no, I would have never.
So I tell people all the time, all it takes is one decision in your life to change forever. And for whatever reason, things happened and you are here financially able to afford this.
Yeah. If I would have, if you or anybody would have told me this 5 years ago, it would have been like a cruel joke. Like, haha, you're funny. No, it's not funny. You know, I would have never thought in a million years that I'd be here. I especially would have never thought that I would have been in a position, in a financial position where I'm able to take care of this. You know, I had questions about, like, would I be able to because of my previous health? Would I be able to because of my previous addiction? Would I be able to because of my treatment in my addiction? You know, like, all these different things that I can think of, well, maybe I'm not going to be able to. And thankfully, one thing that meant a lot to me is you at no point did you make me feel judged, you or Blake, when I told you guys about that part, about my history, my addiction. I've been to doctor's offices, or their whole demeanor will change. They try to play it off like that's not the case, but you can tell, you know, or sometimes they make you feel like it's your fault, like whatever you have going on and why you're in there, it's because, well, it's your fault. And if anything, you made me feel not judged at all. And like, even like how you're saying right now, I commend you because you've gotten clean and all those things. And sometimes it's just nice to hear that, you know. That's one of the reasons why I feel so comfortable here. I mean, you guys have been nothing but nice to me and haven't made me feel judged or that it's my fault or that I'm a lost cause or I'm too complicated. I mean, you guys made it seem like it's easy, if anything. Yeah, you guys have done a lot for me, even in just these last couple weeks.
You've come so far, and I'm really honored that you're here, and I'm really grateful, and I'm just so excited to see Maria in a week. I mean, literally in a week, it's going to be completely different. And so, again, people out there, I just want everyone to understand that, like, I'm actually drawn to those that have had struggles in life. I'm drawn to people who have addiction issues. Why? Maybe it's because in my own life and the people around me, I've seen this play out where good people just pick up a habit, and that habit becomes something that hurts them over time. And for me, it's like some of the people I love the most in my life have had issues like this. And no one's exempt. I told you the first time, like, we all have an addiction of sorts at some part, right? We at times. And so I just want to tell you that, like, you'll never be judged here. Like, if anything, like, you're the success story. Like, I have more respect for you than a lot of people that never even struggled with that, because you overcame it and you're on this journey. And now this is like the final step in your journey to get your life back.
This is like my final reward that I get to do something like this. I mean, I'm already thinking about all the things I'm going to be able to do, all the things I can take pictures, I can eat. I mean, it's like that saying, you know, you don't know what you have until you lose it. And I've really, especially these last couple weeks, that now that I'm thinking of what I'm going to be able to, I think about, like, something as simple as eating a nut or, you know, eating a piece of steak. I mean, I've choked on steak because I can't chew it hard enough. And it's those little things that we forget to appreciate, you know, and I'm just so excited to know that. And if I know not right away, but in a few months, once I'm healed and everything,
Be eating away.
I'm going to Texas Roadhouse, man. I'm eating a piece of steak.
Love it. We got the same place. We love the same place.
Oh yeah.
Well, let's look at your CT. I think it'd be really great. I'll walk you through what I see here. We kind of talked a little bit about it, but let's use this kind of an example to kind of show why you're a good candidate for this. And again, if you have any questions, obviously, please ask me.
Sure.
But the cool thing is that we have a lot of really awesome technology. And
I know I've been seeing this.
and what's cool is that we have different layers of the skull here. And the cool thing is that it allows you as a patient to understand what I'm looking at, because so many people out there, they walk into a dental office and they get really confused because we use words that they're really confusing. And you walk out, and anybody that walks out confused doesn't want to make decisions. So then they're afraid. And so part of what we do here at Dream is we pull up the information, we look at your face, we look at your bone, and we could do that all behind doors, but I like to do it with the patients. I found that as I talk about it with the patients, one, I'm actually treatment planning it in my head as I go through it, but also it allows the patient to ask questions, because things like bone grafts and all on four, people are like all on one, it can be really confusing exactly what we're talking about. And so I'm very, very hands-on. I do have a reputation for talking a lot.
No, hey, I appreciate that. I mean, the more you talk, the more at ease I feel. You know, I feel like you're not holding back. You're not, you know, you're really showing me that you take into consideration what I think, how I feel. You know, I know you've done this procedure hundreds, if not, over 1,000 times.
Yeah.
You still remember that we are the patient. We are nervous. We are antsy. You know.
I think that one of the reasons why I'm that way is my mom has so much empathy towards the people. I think she's the best example in my life. Where if you met my mom, she works here at Dream, and she's the best part probably of Dream, because everyone tells me that, I just love your mom. But one of the things I got from her was that she has so much empathy for everybody. She never judges anyone. That's where I think I'm kind of built that way. And as I look at what a patient has to, there's so much faith goes in to a patient to trust me. I'm literally going in there in your mouth, and I'm basically revamping everything, and I'm taking your money, your hard-earned money, and I'm taking your time. And you're scared because a lot of people are like, "Gosh, how much is going to cost? How much is going to hurt? And what are my guarantees, my warranties?" And so part of this today is we're going to go through the CT, we're going to go through the smile design, and then I'm going to let you ask questions, and even we'll take some questions off of YouTube or Facebook if they're out there. And so, but one of the things that I wanted to show you is that, so this is your, as we look here, the reason we call it a 3D scan is because you have 1, 2, and 3 different layers. So one's looking from this way, one's looking from this way, and one's looking down. But what it ends up doing is it gives us a view over here. So if I take this back, like I can do this here, right? Yeah. So I take that back there. When we layer it all together, you see how now those 3 different views show this. And this is what people will see oftentimes and relate with and go, oh, okay, now I understand it.
Right.
And so if we look at your CT here, and let's just pull this up now. We were looking at your face a second ago, but if we look here, let me just change one little setting here. I'm going to put it to transparent bone. So I like this one. If we look this one here, you can see that, we'll do shiny a little better. So when we talk about bone loss over here and it confuses people, now you can kind of see how the bone drops there?
Yeah.
And so that bone that drops there, it used to be high like this yellow line. Okay. And so it's dropped here. And so why is that important? Because when you have bone loss, it can just limit the type of treatment that you can have. So for example, if you were coming here for the very first time and you weren't actually committed to all on 4, then we would start at scratch and say, okay, tell me what your problems are. Why do you want to have it done? And let's say you're like, listen, I care less about my smile. What I really want is to be able to eat. Well, to eat, you have to have back teeth.
Yeah.
Right? So let's say we didn't care about the smile at all. We just wanted to give you back teeth. Well, as we look here, we would say, okay, well, there's so much bone loss here and then your nerve that comes out. So everybody has this nerve. See how you have a dot there?
Will you get rid of the face all the way? We have a little bit of the glare.
The face all the way?
Yeah.
How do you get rid of it?
Scroll down. Move it all the way to the left, that bar. Where all the way to the left.
Is that better?
Yeah, now you got a bit.
Okay. You got it.
So those two dots right there, that's where the nerves are? Is that what you're... Oh.
Yeah, so nerves are not bone. Nerves are soft tissue, and they basically are connecting literally to your brain, right? So a nerve comes through bone. It'll come through different structures. And so the bone, the nerve actually enters back here, right where this little notch is here. It comes through here, and then it crosses through this bone. It's called the mandible. And so it comes right through here, and then it pokes out. And so what we're seeing here is a foramen. It's actually just the opening to where the nerve comes out. And then it innervates, or it gives sensation to all of your outer, like your lips, your face. So why is that important? Well, if you have lots of bone loss and your nerve, and then the problem is you can't put implants into the nerve. It's kind of like you have this rattlesnake. I've been using this analogy. I don't know why. It's like a rattlesnake down there, and it's like we as a doctor, we know where it's at. We can get close to it, but we can't touch the rattlesnake because if we touch rattlesnake, we're going to get bit, and most importantly, the patient's going to have.
I've heard you say that before.
Yeah. And so with you, the options, if let's say you weren't committed to having an all-on-4 treatment, but you wanted to have teeth back there, we'd have to do extensive grafting. Okay, so we'd have to build the bone up super, super high. And here's the problem is the bone in this area is actually very, very difficult to grow vertically. And most doctors can grow bone horizontally. We can do that with special materials, and we sometimes will put these meshes over it, and it's really complicated, but we can grow bone horizontally. But to grow bone vertically, which is your biggest problem here, it's so challenging that like we would take money from you and say, I hope it works. But literally that's kind of like how it is. And that's how I feel like, that's why for me, I'm very, very selective if I ever do any bone grafting, because I've actually tried to graft cases like this and had moderate results. At the end of the day, they can't do the treatment that they want. It gravitated me towards all-on-4 because with all-on-4, it's quite different. Instead of putting implants back here, we basically are going to take an implant and we're going to move it out of the way so it comes in at an angle. And I'll draw this over here. But so we avoid the implants and we tilt. So we, instead of an implant going in vertically straight, now we're going to tilt them back. And then once they're back there, we correct them with a special post called a multi-unit abutment. And so why is that awesome? Because for someone like you who just wants to eat and smile and have that, you don't care about having bone back there. What you care about is you want to be able to eat, you want to be able to smile, you want it to last a long time.
Yes.
And so this treatment is the whole reason why it was invented, or why it came up with it, was because they were trying to find a better way, because the other way was so unpredictable. And the other way, it takes anywhere from 12 to 18 months, right? We're going to do this in 10 days.
So
10 days,
one
18
of the
months.
very first things I was so like reluctant and hesitant was because everywhere else that I was looking at, be it a 3-on-6 or all-on-4 or all these other ones, I thought this was going to take like a year.
Yes.
At least a year. And then I was wondering, how am I gonna eat in between, or when do I get my teeth, or how does this work? It just, especially if they don't have an in-house. There's any con that I had in regards of getting something like this happen. You guys don't have that con. You guys have your in-house lab here, so it doesn't have to take forever to get it shipped out and come back. And I'm just amazed it's going to take a week.
So, and the cool thing is,
wow.
An in-house lab is basically where most dentists, they have to send the work out,
right? And
then it takes 7 to 10 days just to be able to get something back. And it's this juggle between going to lab and back, and that's why treatment ends up taking so long. And so when I was looking at this overall, like, I'm a control freak. I admit it. I'm sorry. It's just who I am.
It's a good thing, though.
Some things I'm just like, I don't want any, like, I go on vacations. I tell my wife, I'm like, I just want to sit on a beach. I don't want to take any decisions. I don't want to think about anything. But in this treatment, I am a control freak, and controlling the patient experience is so important to me. And so buying the milling machines, buying the printers, buying the scanners, doing all this, like, you have to have so many so many different pieces of equipment to be able to pull this off. But at the end of the day, what the cool part about it is that we can do it in 7 to 10 days. I say 10 days only because it goes through the weekend. And
Right.
heavens forbid my milling machines go down over the weekend. I always say I get 3 days to get to
There you
finish.
go.
So, but if we get back to your case here, I talk too much. So
Am I going to need any type of grafting
perfect question.
of my bone or anything?
So every place that I extract a tooth, I'm going to graft into. So
Yeah, I remember you saying in that last video, if you take, you put back.
yes, and that's not something that is routine with all on four. It's actually called the graftless approach, meaning you're not supposed to have to graft. But I don't ever understand why people don't graft anyways. I mean, people are paying $40,000 to $50,000, sometimes $60,000 to have this done and upwards. I mean, once you go into Zygoma, it can be even higher. But at the end of the day, like, you are open, you are ready, you're basically under anesthesia. Now is the time to build Fort Knox, right?
Right.
Like I always say, like, why don't we add bone in right now? And again, I know that I believe in science, and science says we don't need to, but I also believe that it doesn't hurt to put it back in. Does that make sense?
Yes.
Science says that, you know what, if we put 4 implants in and they're in solid bone and they have good tissue around it, we don't need to have any grafting. But to me, all the little sites where you have teeth, it creates these little pockets, right?
Right.
Little holes. So that's why we graft into there.
Oh, okay.
We graft in, and so I don't necessarily cut bone away. All I do is redistribute bone. So if you have an edge because it was holding up a tooth, piece of bone, I'm going to clip that, then I'm going to cut it into tiny pieces, and I put it back into that site. Does that make sense?
Yeah.
And people like that because what I take away, I give back. I take nothing for myself. I give it all back to you.
Right on. See, and I thought, based on other things I've seen, other videos, that you were going to like literally shave down my bone all the way down, you know,
Yes.
but here that sounds a little more beneficial,
Yes.
you know.
If you don't
take it out
understand
and
why,
put it back in there.
the hardest thing is for people to wrap their minds around a really complex procedure, you know, but that's why I talk too much, is because I find that if I talk a lot, people get closer to understanding.
Right.
And so, for example, when you say shave down, in dentistry or in oral surgery, we call it contouring. And so there are places where it makes sense to contour to make the bone flat. One of the things that are really important, one of the biggest problems we have in this type of procedure, the number one complication, if you were to ask me, what's the number one problem you have? Well, truthfully, it's getting people back to have cleanings.
We had this talk. We had this talk.
and because we do so well that people think, oh, I'm great. I don't need it. I'm great. But the reason why we flatten the ridge is because we're creating a space that you can clean under. And does it make sense? Something that's flat, that has a top of it, now it's easy to clean. That means that even for my patients that don't come back like they're supposed to, I have a better chance that they're going to have a cleaner device. And so we teach our patients how to clean. We've never done a video like that. We probably should add that to our list too. But we teach you how to do it. But then you still need to come back twice a year, at least twice a year. If you're doing a good job cleaning, meaning water picking,
Yeah.
brushing.
I already ordered mine and everything.
Good.
Not ready
That's why I love
to
you.
go.
I love you. But if you're doing a great job, then twice a year. And we don't call it a cleaning. We call it maintenance. Okay. And why is it maintenance? Because it's like when you go take your car to be maintained, or a maintenance visit, or an oil change, they don't just take out the oil and put oil back in. They also check other things, right? Like, it's pretty important when you drive down the road that all the your tires fastened correctly, right? That
Right.
all of them are down tight. Well, that's one of the biggest reasons I like to see my patients back. This device is so strong. We're talking about the zirconia device. It's so strong that we don't have issues with it breaking. It's solid. When people are under a lot of stress and they're grinding really hard, which we all do, I'm guilty of it too.
And I'm a clencher, so.
You're a clencher too.
Yeah.
What can happen is the vibration transfers screw. And so the screw sometimes can create, it can get loose. So it's not a big deal if you come back to your visit. We notice it. We torque it back down to a certain level. And it's not arbitrarily. There's a certain level we torque it right back down to. The occlusion again and see if there's anything we can modify to make it so there's less vibration on those screws. And so people say, what's the biggest complication we have? With some people that are severe grinders, we might have, for the first year, they might have the device loosen up a couple times until we get the occlusion just right. because I want to give you like the sharpest, awesomest teeth in the world. But sometimes it's like you can't handle it because you're like, oh my gosh, this is awesome. I'm just all night long. I'm just chilling. And you grind so much. And so that's another reason why I really believe in night guards. Tell me what you know about the night guard.
Like,
do you know anything about
it?
Yeah.
Use the
do you know
night
why we give? Because I mean, think about it. These devices are super strong. So why would we give a night guard? It seems like it'd be kind of useless, right?
Right. So my understanding was that the night guard is so when we do come back every once a year or twice a year.
Twice a year.
Twice a year.
Gotcha.
I'm thinking like once every 6 months is what my head's thinking. Once every 6 months.
It's okay.
But so bring my night guard, and you guys can kind of see what the implants have been doing while I'm
Yes.
before I come back.
Whoever trained you has been awesome. Great job.
Yeah, he was saying, if you bring it, then we can see how much you're grinding, how it's moving around, how it's getting wore down, and I mean, it helps with the whole of if you clench and grind and all that, it just protects the teeth from that as well.
Because it gives you kind of a break. Having a cushion between allows you to have less vibration at the time that you're not as conscious. Well, you're not conscious. And you can actually bite down, there's different studies out there, but 3-4 times with bigger strength, right? With more force. And so, yes, you nailed that. Was a great answer. So the night guard is important overall, and you bring that back to with every visit, every maintenance visit, you bring it back. We'll look at it. We'll say, okay, yes, looks like you're wearing it. 1, thank you. 2, you're wearing a little pattern here. Let's see if there's anything we can do to adjust it. And they do wear out over time. It's different for everybody. Some people they don't grind a lot, and these things can last 3, 4, 5 years. And then sometimes it'll take a year and a half to before they wear out. So I tell people is that if you're coming back for your visits, then you're going to get a really great deal on your next night guard.
The way I look at it is kind of like if you buy an expensive car, because this is an investment, right? You buy an expensive car, you want to keep up the maintenance on it, because if you catch it early, if there's something wrong with the oil filter, or something's wrong with the tire, whatever. I'm not a mechanic, I don't know, but just if you catch it early enough, it's not that expensive to get it fixed. Especially an expensive car, for example, expensive car. You don't go every 6 months and get it taken care of and catch it in the beginning. By the time you do go back, it's like rattling and rolling, and then it's going to cost you hundreds, if not thousands, to get it fixed, because it is something that's so expensive. So that's kind of how you have to look at it with something like these implants. They're expensive, so take care of them as such. If you need to come in every 6 months, come in every 6 months. I mean,
and if you're like me, I have to kind of be babysat at times when it comes to like no one wants to go to a cleaning or maintenance visit. And the reason why is because it's like, oh man, I got so much to do. I think things are going great. I mean, I'm guilty of not going to the doctor regularly unless I need to. But at the end of the day, it's like what this one visit could help save you life in that situation. But in your case, it's like, you have this expensive vehicle that you purchased. We got to keep it on the road. And so I can't tell you how much I appreciate the fact that you understand that. And if you do it the right way, patients have no problems. It's when the patients disappear for a year and a half, they call us. They're like, my device is loose.
I've seen
broken screws.
I've seen the results.
Water pick in. Let's teach you how to get to that spot, right? Because if you're not cleaning it well, then we basically take the device off and we'll clean it. And then here's the thing is we'll teach you how to get there to clean it right. And sometimes, like for me, like I said, I sometimes need to be reminded of the things that are most important. Give me a little kick in the butt. Hey, you really need to do this, doc. It's like
I like constructive criticism, and that's what I learned,
because we want to guide you, we want to help you, but you don't know what you don't know. You may feel like it can feel perfectly fine in here. And implants could be damaged and failing, and people wouldn't know it. Unfortunately, that happens. Patients that are outside of Utah, which we have a lot of them. It's okay you can get in Utah. That's okay. And then you do them, and you find a good doctor that's going to kind of kick you in the butt when you need to. Make sure you're cleaning right, because again, the biggest complication is people that don't clean or don't return for maintenance visits. Then you start to have a little bit of tissue inflammation, which leads to bone loss, which leads to irritation on the gums, which eventually, if unmanaged, ends up leading to implants failed. And all that money, time, emotion that you've gone through, you have to go through again. And it's a bummer. I've had it happen.
I've seen pictures of what it looks like of like, I mean, if you don't take care of it and your gums recede and then you can see the implants in there and you don't want all that.
Good. So we look here, understand about the bone loss. We have bone loss on both sides. So we're going to angle implants away so the implant will start away and then we'll correct. And then the other thing too I'm really passionate about is we're going to make sure that we keep the things we like about your face, meaning like where your lower lip is. I don't want to move it out here and I don't want to take it back. I like where that lip is in this direction. And so we baseline where the teeth are now, right? And that's why we have all this technology to say, okay, we want to keep the teeth in that direction. And then we're going to lower the chin. And that's one thing we're going to do with you too. As you look at your bite, you have a deeper bite, right? From a side profile. If we bring your face back in here, right? A deeper bite. And what happens when you have a deeper bite is oftentimes you have the chin, not only does it collapses up, so you look more square, right? People will say, hey, you look so different since you graduated from high school. And it might happen, but a lot of times as you lose your teeth, that lower chin migrates upward and also outward. So you look like you have a chin that moves out more forward. So as we bring it down, it also comes back, which cosmetically looks much better. Most people say, gosh, I look so much thinner. I look so much more like myself, like when I graduated from high school. And so with you, you're right, like kind of like we did with Dave. We're not just, it's easy. Anybody can give you teeth. Yeah. That's the easy part. I mean, anybody can do. We want to give you back your face. It's what you see in the mirror, and it's how you feel when you take all these things into account. And so again, with the plan, we're going to open your bite a little bit so that this lower chin here. So these teeth that are here now, we're going to move this chin down to here. Okay. And it'll be probably about 3 to 5 millimeters. I'll write it up, but it's going to give you a longer face. It'll give us actually more room inside of our devices too. And this is so critical because again, we don't want to have to shave down bone, right? We want to preserve bone. And so by us opening your bite and then building into it, we actually can preserve all the bone that you already have. It's good bone. Does that make sense, kind of? Yes,
because okay. I've seen where a lot of other places, they don't take that into consideration. And that's why they say that all-on-4 is bad, because they have to shave off all this bone. Yes. And that's bad because it doesn't come back. So I appreciate that, of knowing that you're not going to do all that,
Good. And as you look here, I'll just point out something else here. So up on the top, we focus on the bottom about that nerve. That's what we're trying to avoid when we put implants in. That's the number one litigated problem in implant dentistry is nerve impingement, meaning that a doctor that doesn't have the right technology or is being maybe moving too fast, he can hit that nerve and it causes numbness. It can be sometimes transient where it comes back over time, and sometimes it will never come back. And that's really, really inconvenient for someone that put their trust in the doctor and put their money into this device, and then not to have feeling in your chin. Can you imagine, when you if you don't know where it's at, you're numb, right?
Yeah,
it's horrible.
Before. Yeah, that's not.
So on the bottom, that's the big thing that we're looking for. On the top, what we're looking up here is we have these sinuses. So do you know what a sinus is? By nature, like generally, do you know, if I said, describe a sinus, does it have bone or does it have air?
I mean, it's hollow.
Yes, it's hollow. Oh. So it goes to reason that we can't put implants in the sinus because it's hollow. It has air. It's not going to support the implant. So that's why on your top, for example, this white line you see here, it kind of comes through, that's the floor of your sinus. So behind that, and if I was to show you here, it's basically up in here. You can see how, because it's more dark. Up in there, that's the sinus. So we're going to also put implants in a way, and I'll actually put some implants in here, or I'll just put lines in for now. So we're going to put an implant. So again, here's the line. It comes up this way. All of this is going to be vacant. So we're going to put an implant, and it's going to be angled that way. On this side, this sinus here, that's I don't call this a rattlesnake. It's like, that's the river or something. I don't know. I haven't figured it out. It's like, it's not the end of the world if we go into the sinus. we just
the dark tunnel.
there you go.
Avoid the dark
tunnels.
tunnel.
But we're going to angle away from those two, because if we go this way like this, that's going to be an error. You can never be supported. In other treatment, Mira said the bone grafting on the bottom.
Mm-hmm.
If you were to go traditional treatment, I would say 10, 15, 20 years ago, they would have to put bone inside the sinus, and we call it a sinus lift, and then wait 6 to 8 months for it to heal, like the bottom, and then come back, then place implants in it, and wait another 6 to 8 months, and then go for it. And so you can have graft these, but it treatment, and when you go that direction, you end up putting a lot more. You literally have your teeth out. You just can't do it. And so at the end of the day, that's one of the reasons why I love all-on-4s, because it's a solution that's immediate, that immediately we can change your life by putting beautiful teeth in. Process in the 7 to 10 days.
What are, I think I'm saying that right.
Zygomatic.
I know you have some of those. It has
Yes.
something to do with the sinuses. I saw in the room a skull where there's like these implants going way up here.
Yeah, why don't you give it to me? I'll show it to you real quick.
What's the difference, or why would you need those?
Awesome. So these are zygoma implants. See, these are more intense, right?
That looks very intense.
I don't know if they can see that, but you can take a look at that.
Man, yeah.
So unlike
They go all the way up here.
yeah, so traditional implants, maxillary and mandibular, meaning they're confined to the maxilla or upper jaw, or we call it mandibular or lower jaw. That means that basically they're going to be implants that attach to this bone, which you have. You have nice bone through here. Even though you have some bone loss and you have some infections in there, that's okay. We're perfectly fine. But some people come in and they've had their teeth extracted many years and they've been in a denture. And so we don't have bone inside the maxilla. And so what we have to do is we have to attach to this zygoma bone. So literally we put implants from here and they angle all the way back and attach here. Yeah.
But that's like when you don't have any teeth. And
yes.
So you've had all that massive bone loss. Okay.
There have been a couple patients in my career where they had teeth and still needed zygoma. But by and large, I would say 99% of the time, it's going to be someone that's been in a denture. Okay. But this is one of the reasons why it's so important to listen to us, because let's say we do all-on-4, and then let's say 15 years down the road, I don't see you for 15 years. You come back and it's like your device is a mess. Your implants have lots of bone loss because you never went to your cleanings. Now to go and fix it, we have to go and attach to the zygoma bone. And that's like the way to bail us out. I mean, like that's the last place that we know we still have bone. There's only been one patient in my career where their maxilla bone was actually so thin that I couldn't. And again, not common, but it's really, really useful for patients that have been in denture for a long time. And
yeah,
it takes more anesthesia. You pay more for anesthesia because it's per hour, right? And then the implants cost me more, and it takes more of my time, so it ends up being more expensive for the patient. And so I always tell people,
I don't have to worry.
No, not even. Okay. Nope, you have great bone. Like I said, every other doctor would say you have tons of bone loss, but for me, you have more than enough bone for what we need. We're going to go in there and actually take, like I said, we're going to redistribute in areas for the bone. And it's because you have nice bone here in the maxilla. And so I was kind of showing on this picture here, this is how a general all-on-4, we're going to basically place the implant back, and it's going to be tilted. This one's going to be tilted also. And then these two in the front are going to be somewhat more straight. Okay. In the case, in some cases, I'll put an extra implant in if I have the space. And again, in what I tell people is people always say, okay, all-on-4, why don't you use this all-on-6? And it's because a lot of times patients actually don't have enough bone for 6. And then if people have the right bone in the right places, I would say it's comparable to like putting 6 wheels on a car. Does it work? Yes. Is it going to maybe create more stability? Sure, I guess so. And a dually truck, yes, you need 6 wheels, right? But for most people, it might be over-engineered to the point where now it's just liabilities, right? Now you have 6 places you have to clean really well. And sometimes when people aren't great cleaners and the implants are too close apart or too close together, you actually can't get cleaning. People struggle getting food in and out of the device. Right. And so again, I make that call in surgery. Some people come in and I know that they can do 6. And what I tell them is this is like, if you're just like, you want 6 because you just want it and you don't, it's like, I don't care, doc, what you think, just keep me 6. Okay, I'll do 6. But I tell people that if I do that, then if I'm in, we just adjust the price. So you pay a little bit more for the implants. In your case, you have great bone. I'm not concerned at all, but it's surgery. The only thing that will happen at times, and I'm very transparent about this, is sometimes the bone can be so soft, and in order to give someone immediate teeth, I have to put extra implants in. If I don't see it in this moment in treatment planning, then you're going to, but what I tell people is sign the consent if it's okay for me to put them in. So I have permission, right? And then if I do that, because I'm doing it so you have immediate teeth. Otherwise, I could just give you a denture. I don't want to give you one denture.
I don't want denture.
But at the end of the day, it's like if I know that I have your blessing to put those teeth in, then I will. And if I do, it ends up being, I can't remember exactly, but it's like a fraction of the cost. Because again, if I don't see here and I don't think it's necessary, but then when it comes into surgery and things change, I want to be able to do what's right by you and not feel, does that make sense?
Yes, yes.
Okay. It's kind of the same things like anesthesia. It's like, if you say, hey, I only want to pay for 3 hours of anesthesia. Well, what happens at 3 hours and 5 minutes? Do you want him just to stop and let you die? No.
Really, yeah.
There's some things that we have to have a little bit of,
Extra room.
flexibility,
Yeah.
because I want to give you the very best. So, okay. Questions so far?
No.
Okay, so that's the top, and I didn't actually draw the bottom. So let me just draw the bottom real quick here. I need to go up. So I'm going to come up here and pull this down just a little bit. And so the bottom is going to be something like this. So again, here's the nerve. We're going to put an implant like this. We're going to put an implant like that. And then we're going to put 2 implants here. So, and then again, the device is going to extend all the way. And that's where the strength comes. Here's something a question I get all the time is how many teeth I'm going to get. And what I tell people is that as I possibly can give you. Okay. All on 4 by nature, we only guarantee 1 molar. Okay. Why? Because there are restrictions on how far we can cantilever or extend back. In other words, if the implant's here and my arms represent the bridge, there's certain, the device is super strong, but at a certain point, if I go so far out, now I might compromise and break, right?
Right.
So typically have about 10 to 12 millimeters from where the implant is. That usually gives people at least 1 molar. And with some people that have a really great spread, like I think on the top, I probably might get 2 molars on you. I'm hoping. I'm going to try to extend. I'm going to really stretch back as far as I can. We're going to use implants that are really long so they can still reach the floor of the nose in the front. That's just nerd stuff. But it's the nerd stuff that makes everything work.
Yeah.
But at the end of the day, I'm going to maximize because I know you want as much teeth as you want. It will not affect your smile. It's like sometimes like that 1 extra tooth or half a tooth. People have come back and said, well, hey, I thought I was going to get 14 teeth. And I'm like, well, it's really just space. It's like I can put 2 smaller teeth in and give you 14 teeth, or I can do 1 large tooth and give you 13. And at the end of the day, I promise you, I just have your back. I'm going to make it problems. A lot of doctors don't look at the CT and they get because they haven't looked at what their spread can be. Can I tell you about spread real quick? I'm totally just want to nerd out.
Hey, I'm learning more. I'm loving it.
Okay, so if you think of the bridge like a chair, you have 2 pegs in the front, 2 pegs in the back, right? So 2 in the front, 2 in the back, and you have a chair. The farther apart they are and the wider they are, the more stable the chair is, right? Same thing with an all-on-4, with a bridge. So we want to maximize what we call the anterior to posterior spread. When I'm looking at your CT, I'm always looking at that. I had a patient come in just yesterday where on the lower, their nerve was so far forward and they had lost so much bone, so the bone had retreated back and the nerve was forward. This patient literally, I didn't have it was like having a chair where it's like 2 in the front and then it's like you're like a stool.
Oh wow, okay.
And so with him, he wasn't a great candidate without doing what we call nerve repositioning. And so this is one of the things I'm saying is because a lot of patients get into surgery, and if the doctor hasn't planned this out super well, they end up with a stool instead of a chair. And then they have teeth that don't go back as far as they could have, right? So at the end of the day, you're going to get the biggest, widest chair you can imagine. Fair enough? But that's basically kind of what it's going to look like. Do you have any questions about the CT?
No, you're pretty much answering them before I can even get them out. Yeah, I think one of what I mainly was wanting to know was about all the loss down
Bone
here,
loss,
but
yep.
you pretty much explained that. I had been told before when my teeth had been extracted, if I ever wanted implants, I would have to have them do, I don't remember the procedure, but I do recall the dentist saying, if you're going to want to have implants later on, since we're pulling your teeth out now, he said there was something that was going to have to get done right then and there.
Yes.
But it was going to be super expensive. And of course, you don't just have that kind of money lying around. So another reason why I thought I wouldn't ever be able to get implants was because I thought that loss was just way too bad now. So it's good to know that it wasn't, even though it's bad, you guys can still work with it.
Yes. Not only when we work with it, we're going to improve it too. We're going to be able to make it so that. Awesome. So
as for the implants, so we don't have implants like that are going to be going to the back. It's all pretty much up here in the front.
There's some water too. Say it one time.
The implants, so they're not going like all the way to the back. It's pretty much just kind of up here in the front.
So they're going to go back. So if I was to show you on here, because I think this is probably the easiest place, they're going to come back to like this point here. So you actually, so it'll be angled up like this. So why it's different for every person is it depends what the sinus looks like. For sinus, remember, if I show you, let's erase all, come down here, let's take these away so you can see better and go like this. So in your case, with your sinus comes in like this. And so we can put the implant back here. So it's like, if you look back on your left side, it's going to be slightly behind that space between your molar and your second premolar. So you can kind of get a feel for that. So because again, we're going to go back as far as we can. What's going to control how far back go is the sinus, right? So we're going to extend all the way back. That sinus right here, see that white line?
Yes.
That right there is going to kind of tell us how far we can go back. So, gosh, go away. Let's see here. Let me try to get it just right. See, so your sinus comes right through here. So that's why I feel really good about we're going to get a really great spread on you. Your sinuses are low, again, vertically, but horizontally they're back far enough that we can get an implant back and angle it forward. So your implants are going to go back, but you really don't even, I mean, in your mind, just it's more about teeth, right?
Yeah.
The only reason why I care about that you know where the implants are is I want you to know where to clean.
Right.
So I'll make sure that I show you. You actually be able to see the metal. People sometimes are like, I don't want to see the metal. I'm like, no, I want you to see the metal because, I mean, you won't see it in your smile, but I want to, and you're like,
when I'm trying to clean.
Otherwise, you're just guessing where it's at. And I don't like people to guess. And so here's a drink. I don't know if you want it, but I was getting a little bit dry.
My next, I think you had mentioned these little spots right here is infection.
Yes.
If I remember correctly. Do I need to worry about the infection during
that's a
surgery
good
or
question.
anything, or is that gonna? Because I know, like when you go to the regular dentist, they always want to clear the infection before
Yes.
they do anything.
Mm-hmm.
Do I need to worry about that or do anything?
It's something that it makes sense for you to worry about, but in this treatment, no, because we are going to go in there and clean out all that infection. Okay, and if you are a super unhealthy person, meaning that, because again, we haven't talked about this, but you got a medical release, you've done blood work. It's something we require on everybody. But if you were an unhealthy person and we did surgery and put implants in right away, then yes, that infection could cause problems in the future. But that's one of the reasons why I don't do any surgery on people. I have two criteria. Do you remember what they are?
Yes.
You can't die on me. So that's one thing. Yet
I won't die.
the doctor says we don't think you're going to die.
No.
And the second thing is we think that you're going to reasonably heal.
Yeah.
And
I
so
told my doctor that. She thought that was hilarious.
so two things I care about. But so like, okay, you have infection there. You can see it right there, right? Yes, it's there. I'm going to take the tooth out. I'm actually going to go down there and physically look at it and take it all away and remove anything that I can see. And then I'm going to take your blood, right? Remember, we talked about the PRF?
PRF.
Yeah, the platelet-rich fibrin. We're actually going to take that and we're going to graft that into that site.
Okay.
Patients can do this you don't have to have PRF for it to heal. A healthy patient will heal without even putting the PRF in there. We put the PRF in there because literally you're taking a concentration of white blood cells that are like, it's like the ambulance of your body, right? When you like cut yourself, that's what sends all the good stuff to go.
Yeah.
It's the nurses, it's the doctors of your body. And so we take your blood and we extract all of that called platelets, and it's white blood cells, it's leukocytes, and they go right to that site and they kick butt and they clean it up. And so what I care more about is that not just that you heal, but I don't want you to be swollen like crazy. I don't want you to have lots of inflammation. And so that PRF also helps to eliminate any problems in the future.
Yeah, I think you guys are the only office that does that. The few other places that I looked at and kind of reviewed their procedure and process, you guys are the only ones that I heard even mention that.
Really?
You know, and I thought that was pretty neat. Again, it just goes back to like you guys really go like above and beyond, you know, all the extra small things.
Yeah.
But those small things make a difference, you know.
It really does. You said it right there. Small things make the big difference. I talk to my grandpa all the time. My grandpa Hendricks, he was an electrician. He's the one that immigrated from Holland, from Europe, and I get emotional talking about him sometimes because I feel like so much of who I am was because of how he taught me how to work. And he always say it's the small things that make the big things.
Yeah.
And if you can't master the small things, then you're never going to be able to grow. And as an electrician, he would also say you have to measure 3 times and cut once. And so why do I bring it up is because it is a small thing. The PRF is a small thing, but it will be for your patient experience. It's going to decrease the swelling so much. It's going to make you heal faster. It's going to give us actually better healing around our implants, which equates to better long-term care. Does that make sense?
Yes.
And so it's a small thing, but I'm telling you, it makes a big difference. Every patient I always do PRF. And we take as much as we possibly can. They're like turning white, and I'm like, keep going. No, I'm just kidding. I don't do that. That's probably not a good joke. No, but I mean, in a day, it's just a little blood. It's like little vials. And we usually take 8 to 16 vials, and then we put them all in those sites. And if you don't have any infection, not a problem. We actually still put it in the soft tissue so that when we suture you all up, you have less swelling.
Yeah.
So that was a really great question. So I wouldn't have thought about that. So I'm glad that you're here. There's so much stuff that's when it's live, right? Because you're getting on the spot. Other questions?
The stitches, I think you said they were dissolvable.
Mm-hmm.
So they just come out, or not come out, but they're just going to dissolve on their own.
Yes.
Okay.
Yep. And every once in a while, like I'm saying, like once a year, I might put in a non-resorbable suture. But if I did do that, I would tell you, so you'd know.
Okay.
But and even if sometimes we'll have a stitch that pops out in the back, and it's not a big deal. If you have a stitch that's hanging down, you can go to the kitchen, disinfect some scissors. I'm okay with you doing this. Just don't cut your tongue. Bad day. But you can cut the suture, and that's not a problem.
Okay.
And so, other questions?
No. I mean, the way that I bite right now, you know how I bite, my front teeth are in front. When I have the dentures, are my teeth gonna be like this, like just right on top of each other, or am I still gonna have where my top teeth are in front of my not my back teeth, but my front teeth, my top teeth are in front of my bottom teeth?
Yes.
Like, is that a normal bite like that, or is it supposed to be?
So you have a right now, and that's what we're going to correct. We don't need you to have a deep bite. Let me see if I can find the right picture here that might help understand it. Let's see if this is any better. If Blake, we'll embarrass Blake if these pictures aren't good. I haven't looked at them. Is that really Blake?
That's me.
No, I have another one.
It might be loading still too, but from us, let's see here. So, well, that's pulling up.
I don't get embarrassed just so you know.
Well,
Okay.
but to answer that question, we are going to correct your bite.
All
And
of them are coming in blurry.
We want this is actually pulling. No, there it goes. See, I just have to wait. I gotta be more patient. So you have a deep bite.
Sometimes when I clench or when I'm chewing or just whenever, that it almost feels like my jaw is kind of like this way, like kind of to my. It's kind of weird to explain it, but it isn't. it doesn't feel like I'm biting like this. It feels like I'm biting kind of to the side. It's just weird. Like it's going this way.
Yes.
And then when he was taking the pictures, I noticed that see how these front teeth are in front of my bottom teeth?
Yes.
Is that how it will be after the implant, or are they just going to be right on top of each other?
No, so you're going to have an overlap. So your upper teeth will still overlap.
Okay.
Think about it like this. Like, let's see here. So it's like this. So your lower teeth right now, here, upper teeth, right now they're really deep. They're like this. And that's what we call a deep bite, okay? We're going to basically take that lower jaw and move it down, okay? And it's going to give you that cosmetic look that you want, right? I know you're going to love that. But your top teeth will still overlap a little bit. We're looking to probably like a 1 millimeter overlap. And then as far as space between here, will be like a 1 millimeter in between. So when you bite down and you're chewing, you're going to be doing this.
Okay.
And so we're going to kind of do two things at once. We're going to give you beautiful teeth, but we're also going to give you a bite that's not so deep because, do you get headaches?
Yes.
Yeah. So I could kind of guess that, right?
Yeah.
A really deep bite oftentimes is a big indicator that you'll have some clenching, grinding, and you're locked in. It's like your lower jaw just doesn't have a way to get out. Do you snore?
I don't think I do.
No one ever wants to admit that,
no,
right?
if
I snore. My wife reminds me of
I think just recently my friend had said, I think we fell asleep on the couch and he said something of like, you were snoring a little bit. I think that's the first time I've ever heard that maybe I snore.
When you have when you have a really deep bite, also it kind of helps. It can add to the problem of sleep apnea and a closed airway. And so in the process of building you up to your ideal smile and your ideal facial length and profile, it should also help with sleeping.
Oh, awesome.
Yeah, you're not going to be grinding as much because we're going to give you a bite. Like right now, because you have the teeth in the front, like this right here, they're so deep and you don't have any support back here. And the lower jaw is a hinge. And if it doesn't have the right support, it really is strained. And so your muscles are strained, which causes you to have the headaches.
Yeah.
And sometimes there's tension up here.
Right here. Even right now as we're speaking, it's here.
I got it right now, Doc.
Yeah, you got it good. It's
this time next week, no way.
It's usually here. And then sometimes I've even noticed when I press right here or I'm speaking or eating, I have like discomfort through here, all through here. You know, and I mean, I kind of connect it all to because my teeth are so messed up. It comes down to here sometimes. It's just really bad. So I'm excited to think that's all going to go away.
Oh, you're going to love it. It's going to be awesome. You know, and so as we look at, so let's kind of move towards, we'll use this as kind of a tool also, as we look at moving forward towards your smile design. Okay. So tell me, you have some pictures here and I'm going to kind of draw on it. Are there things about your teeth, even though they may not be the right color, maybe they're not, is there anything about your teeth that you particularly like or that you want to make sure I keep? You're like, nothing.
Nothing. They're like horrible. They're horrible. I can't really think of anything. It's just, what I do have left is pretty beat up, so I don't remember what they used to look like before.
It's okay. And that's kind of what I expected. But sometimes I'll have a patient say, I really like this. I want to, for example, one thing that a patient might tell me is, I really like having my canine teeth, my fangs. And we're like, they're a little bit longer.
I like fangs. Or not like fangs, but I do want.
You don't look like Dracula, but.
Yeah, no.
But you want to have more of the natural look.
Yes.
And so we want to make sure we add that in because a lot of people, especially younger people, they want the Hollywood teeth are typically more flat. And so it's good to kind of know that. That's how my teeth are too. I'm like you.
I've been looking.
I'm maturing in my old age. I have some gray hair growing in here. My wife reminds me all the time.
I had gotten. I know you had given me the homework of looking at the pictures and
Yes.
stuff. I did find like one or two and stuff. I specifically found one where I know I don't want.
Okay.
I don't. I don't know if I can.
Did you bring your homework here?
Yeah, it's in my phone.
I've heard that before.
Pictures.
Yeah, it's in my phone.
It's in my phone. That's where we take pictures everywhere.
Awesome. So for those who don't know, like for me, I always like to give my patients homework between the consultation and what we call this is our what we call it medic day. And but at the end of the day, what we're doing basically is trying to design her smile. And so I really want her to help me understand what she thinks is beautiful. And yeah, I'm over here now. So let's see what you got.
So let me go to my little picture album here.
Because one of the things dentists is get super clear about what patients like. Because let's say I like chocolate and she might like vanilla, and so we may need to get super clear about it. Because if I give teeth that I always like, it might not be the dream teeth that patients really like. And so I've learned that over the years, is that Dr. Hendricks is just one person's opinion. I can create anything for anybody as long as I know what they like. And so
that's one that I like the most, that top one, because of the canines, how they're really like kind of like fans.
Mm-hmm.
You know,
Love it.
I don't want teeth. I don't know how to explain it, but they almost look kind of short. They look kind of small.
Yes.
I don't want small teeth, if that makes sense.
No, I love what you're saying, because it's looking like you're more of a chocolate person like me. That's good.
Probably.
That's good. That's good. So we want.
I was looking at like celebrity teeth, thinking that would kind of help me, but it didn't, because they all look. It reminds me.
Go ahead and pull up the other one too.
Sure. It reminds me of like cookie cutter. They're all the same.
They're all the same.
You know, very straight. You know, sometimes looks like chiclets because it's just square and white.
Yes.
You know, I would like white, but maybe not Snow White. You know, but yeah, I don't want them to look perfect.
Yes.
You know, I don't.
You want them to look light, but you want them to look natural. We want someone to think, "Wow, your teeth are beautiful."
I'm just
not,
I'm
man.
just
Your
good
teeth.
at taking care of my
your teeth are like lighting the room up in the dark.
Yeah, no.
Reminds me of that. Was it Friends? Right? Ross bleaches his teeth.
Yeah.
I love that one. No, I mean, and that's one of the problems where we talk about chocolate and vanilla. Is I do have patients come in and say, "I want the whitest teeth that you can give me," and I'm like, "Oh no."
Yeah, no.
Oh no. Okay, and I'm like, "Okay, that's fine. Just sign this consent saying that you realize
that's what you really
that
want.
you're going to get." Because at a certain point, we can have people try stuff on, but at a certain point, now we're committed and we can't change it.
We
and
can't
so,
change it. Right. So I have pictures in different places on the phone.
You're okay. No worries.
Just a second.
We're square. I'm just writing down some of the notes we talked about here. We're going to move. So we're going to move also the chin down. And so what I'm doing here is I'm just basically writing down kind of my plan as I look at her teeth. And she's going to show me another picture here. And I said to bring me 2 to 3 pictures of patients she likes. And then I may have a chance to be able to tell her, yeah, I like that. And because my hope is that we get as close as possible with this. For a lot of people.
So this one's kind of weird because it's not on a face.
Yeah, see.
It's just like a row of teeth.
Okay. Yeah, and what I'm seeing here is you like teeth that have more, like they have what we call more square, meaning that some people have teeth that look triangular, where they're square, and as they move up, they have lots of curves in it. Your teeth, you like more like my teeth, right?
Yeah.
Yeah, because mine have more of a square look too. I like that. I think it looks really nice, and I think it would look awesome on you.
Yeah, because even these next ones kind of, I think, look the same. Even those, I think, look kind of the same.
Mm-hmm. If that has a tiny bit more of a curve in the facial surface. Matter of fact, when I was looking at your picture, come back tomorrow morning. So I have to run the clinic at the same time here, right?
I get it. You're good.
So this is a picture when I was looking at your case that I thought, you know what, I kind of like her teeth. Tell me what you think of. This is one of my favorite patients, by the way, too. See how her teeth, do you like those?
That's the picture I showed him.
Are you kidding me?
Picture 20.
I promise in the world, he did not tell me. Like, that's literally the one that
That's the picture I showed him.
So we're on the same wavelength. Yeah. That is so funny.
That makes me excited.
Of all the people I could have picked here, like literally look how many smiles are here.
Yeah.
And we picked the same one.
We picked the same one.
That's awesome.
Yeah.
Anji is a patient here. She's actually one of my favorite people in my practice.
That made me so excited.
That is so cool. Sometimes the stars line up and it's just perfect, right? So
you really got that.
Yeah, I'm really excited. You'll love it. I think they're going to look amazing on you. And of course, when I say those teeth, they're still going to be customized to you. Right. So, but the shape of those teeth is what we're looking for. The shade, I like the shade also.
Yeah.
And because it's, again, could she gone lighter than that? Yes, she could have. But to me, her smile looks so much more natural when you put some grays into it, when you put some blues into it. These are things that a lot of doctors don't talk about, but I talk about all the time because I kind of nerd out about it, and I love this kind of stuff. So
I was trying to find that last picture, but I think being that we pretty much got the same girl, I think we pretty much got it.
okay, awesome.
Yeah.
Okay.
Do you remember the picture I showed you in the book, or when I said it's page number 20? Remember when
you were like, I got it memorized. It's that same book that he's got in his hand.
he picked out the same picture without me telling him.
Oh!
Isn't that funny?
He goes.
I said, I got it memorized. You're like, I got it memorized. I don't need to take it with me. I'll just tell myself.
Yeah, and then he goes, I'm thinking of this patient of mine in the book. I'm going to show you. And he shows me the same picture.
Isn't that crazy?
That's awesome.
It's awesome.
Yeah.
I love it. I haven't had that happen, I don't think ever. Truthfully, I think it's the first time it's ever happened. So this book here is where I pulled out that picture and of you, and I've been writing notes on it. And inside of this book, you can always ask for this book. For the patients that I I teach with, because I teach doctors, that's what the Fearless Kingdom is all about, right?
Yes. I've seen a couple of those.
Yeah. So I like to create patient stories, and that's what this book is all about. Even though we do have a practice where everything's digital, so you can have everything's digital. As you can tell, I'm very digital.
Yes.
But there's something about having a physical copy of something that helps me keep track of things, helps me write little notes, and even those notes sometimes should be put into the computer. The truth is, a lot of times I just love paper and pencil, and so I put notes in here. And so in here, as we go through the appointments and everything, you can always look and see like any notes that I've written. We keep it here, but at the end, you're welcome to ask for it also. It's basically kind of like your storyline, right? In this, it has also your consents, okay? It has your financial agreement and everything there, so you have a record of it also. And so, did we already send that to her? We should have.
What?
Her consents and her financial agreement?
No, she's not gotten digitally. Yeah.
Okay, so you'll get those digitally.
We're going to go over those with her before.
And I'll go through them right now. Yeah. But at the end of the day, you can have exact copy of this also. Okay. When you're signing the consents, did anything scare you?
No.
No? Okay.
No.
I would be scared because
I pretty much read all of it. I mean, you know, the way I look at it is like a lot of it is like what ifs, like if this were to happen,
yes,
if this can happen, you know, and I mean, that's part of the territory, you know. I mean, I'm pretty confident that you obviously know what you're doing. Yep. You're looking out for me, you know, and that's important to me. It's, you don't strike me as I'm just doing this because it's money. Like, you really care my well-being. Yeah. So I feel comfortable and okay with signing everything. I think that, you know, you'll do what you believe is best for me. So I'm okay. Awesome.
And I appreciate that. So I'll cover a couple of things, like frequently asked questions that I get oftentimes. If I ever mess up as a dentist, it's usually not because I've done something wrong for the patient, but I've miscommunicated. And so that's why I do talk a lot. I talk a lot because as you do more and more of these cases, you realize, you know what, I should spend more time in this area. It wasn't clear. And so even though we have everything written down, it's there. A lot of people oftentimes don't even read it, right? It's like, yep, sign.
No, I did the other way. I read everything and then I didn't sign anything.
Oh, well, see, you're smart, and that's awesome. Some of the things that, like, for example, just regular office policies for Dream Dental, just let us know so we'll confirm your appointments. And again, this is for, you know, cleanings and maintenance, everything, 3 days ahead. And so we always ask for 48 hours. If you're going to, like, in other words, we call you and say, hey, we have you scheduled for this time. You let us know, say, yeah, I'm ready to, I'm planning on coming. If something happens, you still have 24 hours to say, hey, I can't make it. Right now, I'm the only doctor at Dream. And so, because you can imagine, I'm pretty busy. Yeah. And so we just want to make sure we have patients that are coming. And so, it talks about that there. The biggest thing that I think that, as we talk about where do people get frustrated, usually it's in the timeline. Historically, when we did implants and we were waiting 6 to 8 months, like the traditional route, a lot of times people thought that they're coming back and they're getting their final teeth. you're not going to go through that because you're basically going to be on steroids the whole time through. I mean, literally steroids, but also like dental steroids. I mean, we're going through this in 10 days or even less. And so you timeline wise, it'll be super clear. Okay. Let's talk about why it has to be 10 days. 10 days, because after 10 days, now it's like that. If we look at our bone and the implants, they are like a cake. It's like we're putting it in the oven. And if you touch it or move it at a certain point, the cake falls. So the first 10 days, we have enough stability because of the way I put them in, that we're fine, that we can take things in and out. It's not going to hurt anything. After 10 days, now we have to let it sit. So it's like the door shuts at 10 days, and now it's like we got what we got. So that's why we tell you got to be very available, and you want to be available. So in other words, I might call you. So we're doing surgery on Monday. You may come maybe Wednesday or Thursday, be like, hey, we need you to come in. We need to take one more little impression here, or we need to take a picture, or something like that. So important to be very available during this time. Does that kind of make sense?
Right. If let's say if something were to happen to where, like, say you give me a call out of the blue and say, can you come in? If for some reason I can't come in till like the next day, would that be an issue or?
Yes, could be. Could be.
This is why
we're having the conversation, right?
Right.
Because so basically Monday is surgery day, right. and basically we're taking everything today, and we're combining it, and we're taking teeth out, putting implants in. Tuesday and Wednesday is basically where we're creating the smile, where we're going to put something in. My goal is by Wednesday that we are clear about what you want. I mean, you've seen something either in the first try-in or second try-in, you're like, I love them, right? I love them. Give me these. I want them everyone. I'm like, they're not ready. So that means that because we can print something to show you what it looks like, but it's not the hard material. Mm-hmm. So the most critical time is going to be Wednesday or Thursday. So be more available those days, because that's something where if we're going to tweak it, then it's like we have to make sure we're moving on it the finals by Thursday. Okay. If we want them by Monday, which is the goal, right? So 10 days are going to be fine, but it's just that timeline where it's like, hey, and most of the time we don't need to. Like 90% of the time, we're good. But if you're just super anxious, like I want to see it one more time. Okay, got it. Be here tomorrow at this time. Yeah. Right? Here all day, every day. It's literally going to after that. But just being available, and it's not going to be like I need you here at this time. It can be sometime tomorrow.
As long as I come, like
yes.
Because like I'm thinking, like what if? Because I know that
I had one patient call us like
overnight.
Yes. We do.
Like, so my concern was like, if you
or my
call me
machines.
in the middle of the night or something, what if I can't come until the morning or something?
Yes, and that's fine.
Okay.
We're so reasonable. Like we get it. You have a life. We don't expect you to drop everything, and we're not going to do that at all. We're going to give you like, hey, come in as quickly as you can, right? And the truth is that we have the 10 days, and we have even data to say that even up to 14 days are probably okay. I just like to have a little cushion. Yeah. So, but I'm not worried. I've never had a problem with that. You want this is very as bad as I do, right? So usually we don't have to like twist people's arms to come back. It's like, yes, I'll do whatever you want. Make me look beautiful.
Right.
So, other questions there?
No.
Okay, awesome. Diet. So even though that you're going to get your teeth, you still have to be on a soft diet during that time. Okay. And what does a soft diet mean? A soft diet means that you can't be chewing in a sideways action. So you can go up and down, it's okay, but you can't go side to side. Like cows, they chew side to side, right? Like this. So we have to avoid food that's going to create that the chewing. So let me give you some examples of things. Am I going too long?
No.
Okay, good.
I think you're doing great.
Awesome. I could talk all whole night.
And
but
I'm loving it. It just makes me feel that much more well-informed and comfortable. So
these are things that people ask, and this is the part, what I'm telling you now are the parts that people get confused, and when they get confused, then bad things happen. Implants don't heal or something like that, and we don't want any hiccups. And so I tell you the most important things, okay?
Right.
So things that, like specific things like steak.
Yeah, I figured that
the all-American diet, when we're talking about like pizza, KFC, Taco Bell, things like that, they're not on your menu. What are the things that are going to be on the menu? Is going to be things that are soft enough that you don't have to chew. Right? If you have to bite down and tear off, that's the action that we have to kind of avoid.
Okay.
So the things that I really want you to focus on is like more of the pastas are probably okay. Mashed potatoes are okay. Actually, inside this
I think you guys mentioned to me that you have like a list
Yes.
of like 100.
A list, and
Awesome.
it continues to grow as people come back. We try to populate this more and be like,
because that will help me.
One of my
get an
goals is to,
idea
like,
of what I can do.
I'd love to have like a cookbook, like where it's like, here's like actually the recipe for things.
Great, yeah.
I know, it's all right. I haven't got to it yet, but I have this idea. But in here, there is a sheet that talks about the diet, and like, so there's 50 there.
So eating pasta would be okay.
Yes.
Oh, okay.
But in the first like couple weeks, we don't need to eat pasta that has like pepper in it, because those little
Gets
pepper
stuck in
spots
there.
can caught in there and cause an infection. And so we want to avoid anything that's nuts, pepper, seeds, things of that nature. If it's something that's homogeneous, it's going to kind of like degrade by itself. You're fine. Because there's acid in the mouth, and it's going to, even if you had something stuck there, we just don't want something that's hard, that's not going to go away, and it'll create that pocket of infection. It's never happened. I don't anticipate it happening, but I saw it in my residency, and so I want you to avoid just those kind of things.
Okay. And then, I think a lot of reason why I don't have questions because I've asked him already, and
I
he
know.
answered pretty much
Good.
everything. The first and second day, was it going to be like just liquids, just like right after surgery?
Yes, lots of liquids, but I want you to go to the store and get protein shakes. I'm okay with ice cream. Some doctors aren't okay with that. I would never tell someone they can't eat ice cream. Like that's just no.
I'm excited to even know that I can eat ice cream. I can't do ice cream because just it remotely touching my teeth hurts.
I have a couple people, the third one, who's asked, what can you eat after you get your finals?
Yes, and so that's a really great question.
Yeah.
So when in this context, in that she's getting her finals in 10 days. So when most people are saying, what can you eat when you're in the finals? That's after the healing, right? So don't get me wrong, like you're not going to heal in 10 days. I understand that. I know that.
There is a difference between you get your finals in 10 days, but you still have to heal. And
Yes.
That's what takes the 3 or 4 months.
Yes. The truth is that there's probably a lot of people still would be okay to chew normal after 10 days, but not everybody, because not everybody are super healers. And so I just tell everyone, like, listen, let me treat you like a regular patient for the first 4 months. You need to be on a soft diet. That doesn't mean a liquid diet. That means that you just can't be, no beef jerky.
How do you know when you're ready?
No beef jerky. So 4 months.
Right.
So how you know you're ready? You're going to come back. We're going to take a CT. We're going to take an X-ray, and we'll look around all the implants, and then we're going to say, here you go. Now we're going to take off the training wheels, and you can have anything you want. Okay.
Oh, my heart just fluttered.
Eat what they can eat, like no restrictions. You say anything you want.
So when they're healed and they're in the finals, when you're healed and in your finals, there's no restrictions. Someone had a question about gum. Can I eat gum? Yeah, that's no problem. These teeth are like glass inside your mouth, and so they're very, very, unlike titanium with acrylic on it that kind of has a rougher surface. These are going to be really, you're going to feel really good in your mouth. It's going to feel like almost like velvet. It's kind of funny. I don't know. I never had them personally. This is what I hear. But there's no restrictions. You can eat nuts. You can eat. You can eat beef jerky. You can eat. There's no restrictions on the diet. All I ask is that you make sure you come back for your maintenance visit so we can look and see how it's going.
Okay.
The first year is the most vital because that's when you're getting used to them. It's more likely when you're going to be hitting in as far as collisions and maybe grinding and clenching. That's when I might want to modify your bite a tiny bit, right? Because I'm going to give you razor sharp teeth. And then as you experience it and how you do, I might adjust a tiny bit as needed. Does that make sense?
Yeah. As I'm getting used to I want to call the teeth implants, but the implants is what's in my jaw.
Yeah.
But when once I have, be it the temporary or the implants, either or, am I gonna feel like a major difference in my mouth to where maybe like my speech will change, the way I talk?
Oh, I love that question.
Am I gonna like accidentally bite my tongue or something because I'm not used to it?
Yes.
That's possible.
But hopefully not. So I say that because
possible.
the reason why is because no matter what I do, I'm taking out your teeth and I'm giving you something that looks better, actually functions better, but it's different.
Right.
So your expectation should be different. It's going to feel different. In other words, like the contours in your mouth are going to feel different, and your tongue and your mind's going to go crazy for the first couple of days. Initially, your speech, there's going to be certain words that's like, wow, that's a little bit different. It's like,
It's kind of like a list.
yes, a little bit. But again, you're young.
As I get used to it, it'll go.
You'll get. I mean, give it a week, and you're going to be able to speak great.
Is that actually brings me to another question. All this work and everything that's going to happen in there, is that going to like ultimately change my structure, like my jawbone, and like is stuff in there going to change? Like, as you lose teeth, it changes in there. So now having this, is that going to cause things to change, or?
It's actually the opposite. It's going to baseline and keep your face
Where it's at. Okay.
Yeah. So we're going to basically make the changes that you want, meaning like if we, again, going back to a little bit longer of the face, because I believe that's what's going to be most healthiest for your joint. And then as far as like lip support, as we look here, it's like your right side right now, you don't have any teeth there. And so if you look symmetrically, this side's out just a tiny bit more, right? Yeah. So you feel the vacancy, right?
I can feel it here.
We're going to create symmetry between that. So your face looks symmetrical on both sides and feels symmetrical for you too. Okay. The cool thing is not just for today or for 10 days from now, like we're creating this for the rest of your life. The question that you should ask that you haven't asked, is this going to last forever?
I'm not asking it because you guys have already answered me. You've already
What's the answer?
It's going to last forever.
Yeah, like you promised. No.
You said, it's going to last forever. So, actually, so am I going to be coming back to you forever, once or twice a year?
What I tell people is that I hope so. So let's answer the first question. Should these last forever? I hope so. What could cause it not to work long term?
Not proper maintenance.
Number one, not proper maintenance. That's the number one complication. And it's because sometimes people just don't take care of things that they know they should. I don't think you're going to be that way. I know that you care so much and you've gone through so much in your life, but I think this means so much that the people that I struggle with the most are the ones that they really haven't had a hard story and I've always had lots of money. They're the ones that I have to convince more and more that they got to take care of this because
it's easy to get it replaced,
Yeah. If there's no skin in the game and mom and dad just bought it, the whole thing, sometimes it's one of those things where the people just don't appreciate what they haven't paid for and haven't experienced. And so, but I intend for these, like the device, the bridge, the teeth themselves, they're strong enough to last the rest of your life. Okay. What we know is that historically we've had this material for 15 so years. Really, it's only become really, really, really popular in the last 5 to 10. And all the data shows that this is a forever material. It's not like it. I don't anticipate it. Year 35, it's all going to fail, right?
Right.
It just doesn't happen. But what I'll say is this: is it all is dictated on or predicated on the fact that you are having regular visits, and because nothing goes from good to horrible overnight. It usually is a process, and that's why in the case, let's say for example, you end up leaving Utah and you're in another state. And it's not convenient to come back. You just want to find someone that cares. And really it comes down to a hygienist that's watching really closely what's happening with your bite. They're taking good notes and finding out, okay, this one screw seems to get loose just a tiny bit. It's not, you don't even notice it, but they take notice, like this one screw. And then having a good doctor to come in and basically say, okay, what could be causing this? Where usually it's a tiny collision here or a collision there. Or it's like, hey, are you going through a divorce? Did you lose your job? Is there so much stress in your life? Do we need to upgrade and get you another device, another night guard, get you more cushion in there? Does that make sense? And so when people say, is this a forever device? I intend for it to be forever. The one thing I cannot control is maintenance. You have to come in. Can't treat what I can't see. Second thing is I need to know as far as if you get any like really big diseases, cancer, right? If God forbid you get cancer, it's okay. Like we have so much cancer in our world, but if you talk to me, we can make a plan so that we help with the treatment, so that we can try to mitigate some of the dryness in the mouth and some of the things that come with cancer and cancer treatment. And so if you have like a serious car accident and it jars your whole skull, again, we need to know about that. We need to look at it because we all have different lenses. I'm seeing things through, I need these teeth to last forever, right? And so another doctor is thinking, I want to save this patient from dying from cancer. He's not thinking about your teeth, right? So it's just the right time to intervene is the sooner the better. And so if you're a healthy patient coming back to maintenance visits, then these implants will last the rest of your life, okay? Awesome. If you come to all your visits too, with our office, if something does come up where it's like, oh my gosh, like let's say I'm trying to think of something that could happen. if something comes up where it's like, okay, here's an example. Let's say you start to have some recession around a tooth. And this could happen because you're water picking so hard. You have a couple of these people out there. It's like, calm down. Clean is clean. You can over clean. Anytime you have too much of one thing, it can be a bad thing, right? And so I've had a couple patients where they water pick like after every meal, and they're putting it on the highest, right? So it's trauma, like literally it's traumatizing the implants.
Yeah.
And so that causes bone loss, actually causes tissue loss, then it ends up bone loss. And so let's say a patient, well-intentioned, gets to a place where now she has a little bit of the implant exposed. You see some threads. If you've been coming back every 6 months and you're like that regular patient that hits all appointments, then when we go to do that graft, like a tissue graft to help solve it, you actually you're in a different category as far as price. I'm going to take care of you versus the person that never came back, never saw them, and now they're coming saying, oh my gosh, it's hurting here. Okay, because if I'm seeing you all the time, I'm looking going, okay, Maria, got to calm down. You're at a 10 on the water pick. No more 10. Let's take it 7. Right? And then the next time you come back, okay, it looks good. We haven't lost any more tissue. Does that make sense?
Yes.
We're guiding you through the process because we just want you to keep we want to keep this thing on the road. But if we don't see it, I mean, that's the biggest thing.
You're my mechanic.
Exactly.
You're
Exactly.
my denture mechanic.
So does that kind of make sense? And then,
yes.
Yeah.
In regards of the water pick, do I start using that right away, like right after surgery? Do I wait a week or two? How does the water pick deal? Do I do it once a day, twice a day? Do I do it right after I eat?
Right out of surgery, you're going to use just a syringe, and you're going to use that water, the Paradex. It's a script that I'm going to give you actually in a minute. Have you talked about it with her?
No.
Okay, so I'll go through that 1 second. It's a prescription grade scope in a sense, like it's a clean your mouth out, and you're going to use that with this syringe, and you'll get it the day of surgery. And it basically is just like a little, you're just going to push water underneath it, but not too aggressive. You're just basically kind of keeping it clean. It's antimicrobial, so it will taste and make your mouth feel clean too, because you're going to want to go and clean.
Burn?
No, not at all.
Okay.
No, most people like the way it tastes.
Okay.
Has a little bit of alcohol in it, and so that's why it's has a script to it, because high school kids are dumb. They can find ways to be. And so, but it has kind of like a fresh feel to it.
Okay.
Most people like it. A few people feel like it dries their mouth out. If you already have preconditions where you already have dry mouth, because the alcohol, when it can cause dry mouth too. But I don't think you're gonna have a problem with
that. Okay. Flossing. Can you floss between the teeth of these implants?
I love that question. That's good. No, you can floss underneath, because remember this device. Once you hand me the model.
So there is going to be space between the actual piece, the actual teeth, and my gum line. So
yes.
I can squeeze floss between there and
yes. So it's like this here. So a couple different models. So there'll be a line. So this is your gums, and these are the gums from the device. Okay. So you're not just getting teeth. We're giving your face. We're giving you teeth, but we're also giving you gums.
Right.
Okay. So that line there, that's where you could floss underneath there.
Yeah.
Most people just water pick.
Okay.
Some people, everyone's different, right? Some people just feel like they have to have floss.
Yeah.
It's just one of those things.
There's a floss.
There's a flosser you can push through, and then
super floss.
Yes.
Because there's a piece of it that's spongy and a piece of it that's a little stiffer.
Yep.
So you can guide it through there. What do you recommend? Is it better just the water pick, just the floss, a combination of both?
So most likely the water pick should be good enough.
Okay.
But that's why the first cleaning, I'll come and tell you you're doing awesome. Or let's say you're saying, I'm doing the water pick, and I'm going, yeah, it's not good enough. Let's try the floss.
Okay.
Does that make sense? So
yeah.
Most likely, because the water pick is the most convenient for you, that's probably what I recommend for most of my patients to start off with. And then as we go through the maintenance, we'll let you know. Okay. The water pick, what I also recommend is if you can get the one that gets put in there's actually one that goes right in your shower.
Oh, okay.
I don't have it yet. I want it so bad. Every time I talk about it, I'm like, why haven't I bought that thing? Remind me about that. But what's cool about that is because a water pick is messy. It's like a power washer. Have you ever had one?
Water pick? No, this will be my first one.
So it feels great. It's like people tell me that it feels great when you do it. It's like a massage on your tissue. But the problem is that it gets on the mirror. You're right. And so if you have it installed in your shower, it makes it so that every time you take a shower, you just water pick. It's It's a great reminder to do it.
So what I ordered was one. It's the big thing for like the bucket of water and everything. But then I got one that's like it's wireless and portable.
Mm-hmm.
So I figured I could use that in the shower, for example, so I don't leave a mess everywhere. Yeah. Okay.
It's great.
One of our patients commented back and said that she was able to find a water pick. They have implant heads now. Specific for
nice.
these devices.
Yes. One of the ones I got, the bigger one I got on Amazon has for all the different head combinations for if you have implants or crowns or braces. So depending on what you need, you can change the head tip.
I need to upgrade mine.
Yeah.
Looks like I got the old one.
Yeah, I think so.
Got the camera.
So again, so at the end of the day, that's what makes this device nice is that we're going to add the gums in. So you're going to have those gums long term, right? It's why another reason why I love it better than the 3-on-6, for example.
Yeah, that was the first thing I thought of, and I started to see a lot of reasons why I wouldn't. And he actually, Blake made a good point. My gums aren't healthy, obviously, and if it's just the 3-on-6, there's going to be a big difference between the teeth and my gums. And I've seen what it kind of looks like when your gums aren't healthy. It almost looks like the teeth are standing out from the gum. It looks weird.
Well,
So
and in fairness for people, there are people out there that that they are for 3-on-6. It'd be the people that have a lot of bone in the back. So because you have bone loss on the top, on the one side, and a lot on the bottom.
Yeah, like I can't even picture how that would work. Being that back here it dips down. And it
doesn't work.
How would that fit? How would that work?
Exactly.
Do I need a water pick more than once a day, or like when I wake up, when I go to sleep, or is it like when you have braces that you do it after every time you eat?
No, you don't have to do it between every meal. And that's the thing is some people get a little crazy and they do it too much. And so we'll know better how you respond. Maria, because we're going to write a book to how does Maria respond? So I can give a blanket statement and say this is how everyone should do it. But the truth is that's why you have a doctor that cares is we might modify it, but this will tell you at the beginning. Twice a day is good enough. Okay. Properly, and we'll know after your first cleaning. Could you do it during lunch also if you want to? Yeah, no problem. I need to look twice. And the biggest thing is to me is it's making sure you clean in the most important areas. You know, you're gonna have these 4 areas where the implants are, and so we want to make sure that you hit those areas. That's the most important because that's where the implants can get down. Does that make sense? You'll water pick everywhere, but that's what gives us stability long term.
Okay. Some questions I had, not so much of the implants, but like of surgery.
Yes.
So, I mentioned I do take methadone.
Yes.
For my maintenance, for my addiction stuff. Is there any contraindication between like the methadone and the anesthesia because it is a narcotic or anything like that? Is there a concern? Do I need to worry?
Right now, shoot, it's kidding. No, you're good. So let me answer. No, you're like, wait. After all this,
She
no.
looks at me like, it's okay.
You know, I love you.
Yeah.
This is Dr. Hendricks, right? I had to joke with it. No, so
the look on my face.
You're like,
kinda
what?
Confused. Wait,
Eat real quick. Like,
what?
wait, you said.
So to answer that question, no, I have so many patients in the same boat as you, and so no, we've had no problems with
Would
that.
I be so I take it early in the morning?
Yes.
Would it be okay to take it, or should I wait till like afterwards or something?
Plan on taking it. Okay.
Take it.
Plan on taking it. You're gonna get a call the night before from our anesthesiologist. He's actually a nurse anesthetist. And he's amazing. He's one of the best parts of Dream. He's almost like a full staff member here because we do so much. But he is going to look at your medical history and he'll tell you exactly what he wants. Remember, he's the one that's going to make sure you're while I'm doing the surgery, changing the life, he's going to make sure you're alive. Yeah. And so he appreciates because we're one of the few offices that do the medical release, that do the blood work. There's been many times in surgery where he literally pulls up the blood work himself. We can look at it together and be like, I wonder what's going on here. Yeah. And again, I like more data than less data. And so to answer your question, I don't anticipate it's probably going to tell you to stay exactly to do. We probably want the way I always interpret is we want your body to act normal the day of surgery, right? We don't want, if we just went through that, that would probably cause more problems than not. But that said, Mike is so good at what he does, he would be the one that tells you to do that. I'll support whatever he tells you. Okay.
And then also, because of the medical release and the blood work,
Mm-hmm.
I have found out I have hypothyroidism. Would
See?
that be an issue? I found something. I didn't know.
That's what I'm talking about.
Yeah.
Because you wouldn't have known otherwise, right?
I didn't know.
Yes.
I didn't know.
So
Is that a concern in regards of surgery, in regards of what's going to happen? Do I need to worry about it because of the implants? Because that's something I had no idea. So to me, that changes me a little bit because I'm not as healthy apparently as I thought I was.
Yeah.
Does that
The thing is that with everything we're doing here, we're probably going to make that hypothyroidism a better baseline's back. You're going to get healthier because you're eating better, and so I anticipate that you're actually going to have improvements in that. But from my perspective, I'm not concerned about that affecting our ability to heal. Okay. If the numbers were off the charts bad, then we would have had the flag raised by your doctor.
Okay.
Right. I'll look at your numbers in your blood work too, just because have a second eye is always good, right? But if we have, again, anything that's severe in one way, hypothyroidism, there's always like that gradient of like where are you at in the mix. I'm guessing you're probably at the beginning stages where it's just a little bit off, right? And so I think your body's still going to respond.
Yeah, I mean, I just recently had 2 surgeries.
And you healed up great.
Carpal tunnel. I had one hand, and then a month later the other.
Yep.
And that was less than 6 months ago, and I healed.
No
great.
problem.
No problems, anything. But
I think you're going to do just fine. I'm not concerned about that at all.
Okay.
But the cool thing is we have the blood work. And so that's really nice because let's say we do have a hiccup of sorts. Let's say you take longer to heal. It's nice to have that baseline to know where you were on day one.
Great.
And now that we get you, are you treating that with medication?
I'm sure we're going to.
Okay.
Right now it was just, she let me know, but since I was there more for the physical for the release, but she said, I'm not worried about you. Go ahead and get it done.
Do me a favor and just follow up with that. Make sure you
yeah, definitely. Yeah.
Because again, I always tell people, I hate when these beautiful teeth, beautiful implants go into someone and they die the next day. It just doesn't, it's a bummer.
Yeah, well, I don't think I'll die from hypothyroidism, but thank you.
No, but at the end of the day, take care of yourself because I do care a lot about you. And I'm glad that the medical release kind of prompted this. Now you're probably going to, once you get this all equilibrated too, you're going to sleep better. You're going to probably start to burn a lot more calories also, which in the long run of everything, I know that you're like, this is your year, right?
Yeah.
You're going to have you're going to have dream teeth. You're going to be on the dream diet for 4 months, which is awesome. You're probably going to shrivel into a little bit.
I'm like, I'm going to lose weight.
We're going to make that face thinner already too. And I'm telling you, it's going to be an awesome year for you.
Definitely. So, how long does the surgery last?
How long does the surgery last? So,
I know I'm here all day, but just the surgery itself.
So, I would plan on anywhere from between 3 and 5 hours. Okay. Why? The surgery actually might be done, but while you're asleep, we're taking some records. In other words, we have a lot of scanners that we're actually scanning in the mouth.
Okay.
And when someone wakes up, they're so groggy sometimes they won't open their mouth. It's hard to get those records because we have a 7 to 10 day turnaround. We have to get a lot done in that. So on average, like I said, maybe 4 is maybe an average. And sometimes it might go a little bit more. I tell people that if we stay in there longer, it's because we're trying to get it all done. Sometimes I might have to put an extra implant in for stability, things like that.
And then on that first day, I'm not even getting the temporaries on the first day. The first day I'm going home toothless, right?
Yes.
Okay. Am I going to have anything in there to protect or cover, I don't know, cotton balls?
So where the implants, so yes, you'll leave with a bag that has the syringe in it. It has your post-op instructions that are basically, don't be stupid, most of it. Don't do dumb things like going and working out. Don't use a straw. That's all things that we'll talk to you before you go to sleep when you come in next. But in that bag also, you'll have, you'll have gauze so that if it does, it's very normal for you to bleed the first day. In other words, if you go home and you take a nap because you're still groggy and you wake up and you have some blood coming down, that's totally normal. That's the way the body kind of is getting rid of all that infection, right? And we saw the infection here. And so it's purging itself. And so but we have gauze there so you can put it in there, bite down, put a little bit of pressure, and that should help stop the bleeding.
And then
with that, don't go use your nice linens and sleep. Go find the old stuff, right? I've had to replace a few pairs. Oh no, so.
And then I think it was in the paperwork. I think it was where I saw it. don't sleep. I can't sleep on my side or flat. I have to be kind of like sitting up. What is that for?
Because gravity works against you in healing. And so it's like when you sprain your ankle, you have to sit back and put your foot up. The reason why is you want your foot above your heart, because if it's below your heart, then gravity is going to pull all that blood inside there and then you swell. So we want you for the first couple nights to keep your head elevated. So we want you to sleep in a recliner if you have one. That's your number one choice.
Okay.
If you have a recliner, sleep in a recliner. If you have a recliner, then you're going to put like 7 or 8 pillows and you're going to strap yourself. No, you don't have to strap yourself in, but you have to have someone there that first night to make sure that you don't lay flat, because I'm telling you, I actually had this just recently within hours. I'm just telling you, where someone laid flat. I know they did. They won't admit it, but they did. And they look like a chipmunk. They look so much more swollen than normal. And so we want to use just physics. Gravity works. If we keep the head up, you're going to have a lot less swelling. So the first night, the biggest things you're going to do is you need to keep your head elevated. You want to make sure that you ice when you're awake. You don't need to ice when you're asleep. I don't believe in that. That's too hardcore. I want you to be warm when you're sleeping.
I don't see how do you sleep with ice.
I have patients that will do it. I'm like, really? That's crazy.
Good for you.
I've seen a couple patients that buy like this head thing that holds ice.
Oh, that. Oh God, I don't think I could do that. Yeah.
And then the big thing, so head elevated, ice, and it's 20 minutes on, 20 minutes off. Everything I'm telling you is written too, just so you know. You don't have to memorize this. We'll also tell you this again the day of surgery.
Okay.
And then you'll get a call that night too. Like, if you're like me, you have to hear things 3 times. I'm a slow learner, I guess.
I am too.
So the third thing you have to remember on day of surgery is to take your medication. Okay, so your medication is going to be your antibiotic. Okay, and that's what I have here.
Now, do I get that at a pharmacy, or do you guys give me them?
We have scripts here. You take them.
Yep.
And I recommend you pick them up today. You're going to start the antibiotic 3 days before. So Friday. And the antibiotic that we have for you here, you don't have any allergy penicillin, right? Okay, good. That's what I read. Yeah, and they're right here. So that you have your antibiotic, which is Augmentin. Okay, Augmentin is a penicillin type drug. It also works really great for the sinuses too. Most people do really great and they don't have problems. Every once in a while, have someone that has stomach issues, and if we have stomach issues where it's like you're having, I don't know. It's rare, but if you do, we can change this. This is my go-to. It's my number one. If this doesn't sit with your stomach, call me and I can change it.
Okay.
But most likely you'll do great. So that's Augmentin. You're gonna start that 3 days before. Okay. On Friday, and then the other thing that you're gonna start using on Friday too. Is going to be the rinse. Remember I told you about that rinse?
Yeah.
Okay. It comes in a bottle. You're going to, fill up the cap, or you can chug it one way or another, but you're going to rinse, and to keep it for 60 seconds in your mouth, spit it out. And then here's the thing, no eating or drinking for an hour. Okay. After. It's like some people will like follow it with like a Coke. It doesn't work. You got to make sure that I've heard it all.
That sounds like something I would do if it tastes nice.
I would totally do it too. That's why I'm telling you. So you let it sit for an hour.
I'm a Coke drinker.
Because we want that antimicrobial to basically eat up all the bugs. And so you're going to start doing that right away. Matter of fact, that's one that you could start even before Friday. If you feel it, you'll get an idea. It's actually pretty pleasant. My wife, she uses it. And we refill that one routinely. Like we refill without any questions. It's very, very safe. Just don't swallow it and drink it. There's other ways to go that direction if you have to. Okay, so that is called chlorhexidine gluconate. Okay, that's the one that comes in a bottle.
These just roll off your mouth.
I know.
You said these a lot.
It's a rinse. It's the rinse. Keep it simple. Okay. It usually is blue, and so and you can put that inside the syringe also. We're not telling you about you use it.
Could I? So I'm assuming I'm going to be using this for a while.
You're going to use that until I tell you to stop.
Okay. So I'll be using it whilst I'll be using like the water pick, for example.
Yes. Most people never stop using it. They love it.
That's what I was going to ask. So can I like mix it with the water and water pick? And
exactly. Perfect. That's what all medications do. Okay. So the other 2 medications, these are it's a steroid called the Medrol dose pack. It comes in a box. And the top row has 5. In the first day, you're going to take all, actually, I think it's 6. top row, and then day 2 it's 5 pills, and then day 4 it's tapered. So
You take them all at once, or
no.
throughout
So
the day?
the script basically says to take it like the first day is 6 pills, and so it's like 2 in the morning, 2 in the afternoon, 2 at night.
Okay.
But here's the thing: is I don't care if you take them all. To me, I just care you take them.
Okay.
So if you're not great at remembering, like me, I'm not great at remembering. I work. I get so intense, I forget to even drink. My mom has to bring me down and force me to eat all the time. And so if you're like that and you get distracted easily, then just take them all at once. That's fine. Okay. Recommend do it earlier in the day rather than later. Sometimes it'll keep you up if you don't.
Okay.
So that's the steroid. We'll go over this again, and also the pharmacist will go over with the two. So.
And that'll be for after the surgery.
Yes, that will start a day after surgery.
Okay.
I don't want you to feel like if
I'm sure that Mark will make me take these medications.
We're going to give you a steroid in surgery, and so you don't have to take that until a day after. Okay. And then the last thing is Sudafed. Okay. Sudafed is just like it looks like over the counter. But the nice thing is this is in a script to make it sound like it's really important, because it is. But see, if I just tell you take Sudafed, people are like, oh, it's just. But in surgery, this is important because it's going to help make sure your sinus stay clean. Okay. And so I'm such a nerd, I have to say this. The steroid is going to help create access. It creates it dilates the hole that from your sinus into the back of your throat, so it helps clean out any congestion. The Sudafed is basically like the oars to help push the stuff out. And the day of surgery, it's very likely that as we get in there, we may be right up against the sinus, and it might cause some congestion, it might cause some inflammation. We want to make sure that we don't clog up and get an infection in there, and that's what that does. Okay. In addition to it, it also causes less swelling. Okay. Again, so what are we doing as far as managing pain? Well, we're starting 3 days before with antibiotics, and then the day of surgery, also the morning of. Not the day before surgery, before you go to bed, I'm gonna have you take 800 milligrams ibuprofen. Okay. And that's basically just a loading dose to help you be ready for the day morning. We're trying to basically set the card straight so your body's going to be,
That actually brings me to my next question in regards to pain management, because I do take the methadone.
Huh?
So it's not for pain management.
Yes.
But because I do have a more higher tolerance, I guess.
Mm-hmm.
Afterwards, if will I be getting anything just in case it is hurting? Like pain management for at home.
So
I don't know.
So in the previous surgeries, what have you done? As far as after the surgeries, what have you done to manage pain?
I know. Let me see. So with the carpal tunnel, I think they gave me oxycodone.
Okay.
And I didn't even take the whole prescription. I was taking I was pretty much taking it how it was directed on the bottle, and then maybe out of those, I'd skip maybe once or twice. So I wasn't taking it religiously throughout the day, just when it would act up. So maybe 2 or 3 times out of the day, I would take it.
And the doctor that you've been working with, that they got the medical release, they're the ones that prescribed methadone, right?
No. So this is it's the specialty clinic here in Salt Lake City that I go to.
Okay. So what I want you to do is I want you to reach out to them, let them know that you're having surgery. Okay. And this is all in your honor. I know you'll do this for me though. I want you to let them know you're going to have surgery and you're anticipate there's going to be some pain. The truth is that most of the time, my patients don't need any narcotics. Truthfully, we don't need them. But there's sometimes that they're useful. So, because the day of surgery, I'm going to write a small script for a narcotic. I just want you to reach out to her and say, are you okay with him writing me this script? Because we just want to make sure that we keep our agreements with her. At the least, it's going to give you what you care most about, which is integrity, that, hey, I'm going through your surgery.
With the methadone, right?
Yes.
Yeah, I have to let them know anyways, because we do get drug tested.
Yes.
And apparently whenever I pick anything up at the pharmacy,
they have to know.
They get a red flag, lets them know that I picked something up. So they would know anyways. But
awesome.
Because we do get drug tested and all that stuff, I do have to let them know.
So let her know, or him know, whoever it is. See, now I think it's a her. But
the one that did the medical release.
And said, yeah, Tylenol, ibuprofen. We follow our instructions, didn't have to take one painkiller at all.
Yeah. And so you'll probably be great. You'll probably be in that 90% that really don't need anything extra. But let's reach out to her so we have the blessing if we do need it. Does that make sense? And then we'll keep you clean as far as with her and him. Him.
For the addiction treatment, my primary care is technically also him. but because when I went for the medical release, my doctor wasn't available, it wasn't hurt.
I will blow your mind. I think that if you do everything that we tell you to by the perfectly, you're not gonna have any problems at all. So, but reach out just in case you want to.
So it seems from all the reviews I've seen, all the videos I've seen, your patients are
It's
like
crazy, right?
0 and 3. That's crazy.
Yeah, I mean, over and over again, it happens all the time.
I'm pretty confident. I remember last time I went to the dentist a couple years ago, they removed all these back teeth that are missing now.
Mhm.
It was like 7 teeth, and I went to work that same day, that night, and I had no pain.
Yeah.
So I'm hoping it's kind of the same thing, you know.
Yep.
I'm just, because I know this is surgery and you're doing a little more opening stuff, maybe it'll hurt. So that's why I'm just kind of, you know, sometimes I worry because I am told that my tolerance is a little higher. So if something does hurt, it takes a little more to make it not hurt.
Well,
so
and
that's when I worry, because I'm like, what if I do hurt, and then what am I going to do to make it go away?
we got your back. I promise. You have nothing to worry about. You've done everything right. Reach out to them. So that's the last little step that you could do just to make sure that we're okay. And then we don't mess things up for you, right? And so, but thank you. I appreciate you being, you know, that's a perfect question because a lot of our patients have that same thing. So other questions?
No, I think I'm good. Yeah.
Okay. So we went through the medical history. I've already looked at that. I got your prescriptions. Let's see, as far as I'm looking at my to-do list here. Oh, patient caregiver consent. That's inside here. Have you talked to her about that all?
No, I left
Okay.
everything.
This is new to like 2020. You're hot off the press here. This is a form that I want you to have whoever's going to be with you the night to fill out. Mark.
Yeah.
I want Mark to fill this out. Why? Because I could totally crush it with you, meaning I could give you the most amazing experience. But if Mark has a bad day, guess what? You're not going to like me. Meaning we want him to understand how the day is going to work.
Okay.
And so I will see him the day of surgery.
Yes.
But a lot of times I don't get down and get. So this is medical consent, basically knowing that he understands. So you're going to show him all this paperwork so he understands what to do day of surgery. Pre-op instructions, post-op instructions, just share them with him. Educate him so that he knows. Because again, I've had this happen recently where we educated the patient, and this is what stroked this whole consent. Because the family didn't know, they got upset at us thinking that we did something wrong because they're like, wait, I have to wait all day long because we said they have to be here all day. And so it's just some of the basic things, knowing that you're going to be here all day on Monday and that you need to be available Tuesday and Wednesday, not the whole day, but we'll let you know how, depending on how it goes on Monday. We want him here on Monday and Tuesday. He doesn't have to be here the whole day. He just needs to be here. So in other words, he has to pick you up obviously on Monday. But on Tuesday, when you get your Tuesday or Wednesday, when you get your teeth, we also want him here. We can accommodate him as far as when we put the teeth in and stuff, but we want him here also. So when you get your teeth, you see your teeth the first time, you both get to experience it. It's really important to me. I want it to be because it's the icing on the cake. It's the style points. Like to me, it's not enough to give people nice teeth. It's not enough to change their life. I also want to give it to them in a way where they can enjoy it with the people they love.
Yeah. Even
Does that
my
make
daughter
sense?
from California, she's like, you have to FaceTime me when they do that. I want to see.
Okay, cool. We'll do that. I love that.
Yeah, I'm excited.
Awesome. Does that make sense? You're good with that? Okay. So that consent right here, just fill it out and then bring it back with you. Okay. Send it in with Blake. Will you just make sure we get it? So it's there. Pretty straightforward.
My
She didn't have
doctor,
surgery without it.
Yeah.
wanting the extra step of knowing it's okay in the medication. Do you need me to give you something that she's signed or anything, or you just want me to ask her?
Because I think that just inform her and say, how would you, there's two ways you can do it. I can write you a script or she can write you a script. Okay. He should write
He
you a
won't
script.
do it. They just work with this.
Okay.
The methadone. They won't
Okay.
do scripts or anything.
Awesome. And so just letting them know is enough for me.
Okay.
You've done so much hard work. I'm not concerned. You don't want to screw up what you've already worked so hard for.
No.
So I'm not worried about that. Other questions?
No, you guys have been great at answering stuff even before I need to ask. I mean, you guys just have so much information readily available that it pretty much answers it even before I'm here. I mean, I've watched your guys' videos, your reviews, all of your YouTube stuff, so it's pretty much answered everything. And before I got to you, I have Blake's, and Blake's pretty much really good at answering.
He can't stop talking either. That's the problem.
No, it's great. Hey, I love it.
Usually
I can't stop talking
it's
to
our
you.
it's our strength, but also can be our curse when it's like, oh my gosh, It's 8 o'clock. Why are we still here? I've been talking all day. That's why. So just to review, the biggest things, how do we win? Ultimately, yes, I'm going to give you a beautiful smile. I'm going to make sure that I give you all the things we talked about today. Communication. I have to communicate with you clearly. You have to also communicate with me. And I think you've done awesome at that. And so please continue that. Communicate with me about the smile. Communicate me with as far as the pain. And as we go into long-term over the years, communicate with me about your health or anything that's going on in your life that would affect your teeth. And if you're not sure, just ask me and we'll see if it does affect your teeth. The day of surgery, again, you're going to be here all day, even though you won't be in surgery all day. Second day, plan on being here all day also, even though you're probably not going to be here also. Plan on it. And then the night of surgery, what's most important is we manage that pain. We're going to manage it by keeping our head elevated. We're going to make sure that we ice it. We're going to take our medications. The medication I didn't cover was I also want you on ibuprofen and Tylenol every 4 hours. Yeah. It's written for you, but it's how we manage it. It's a 400 milligrams of ibuprofen and 500 milligrams of Tylenol. You take that every 4 hours, even through the night, and you're going to do amazing. Okay. The last thing is as far as diet. Yes, I want you. So again, 1, head elevated. 2, ice. 3, medications. 4, I do want you to eat. I want you to be able to get, I want you to replenish your body, or you're going to wake up the next day and be like, feel like you just have no energy.
So on the day of surgery, after surgery, you do want me to eat?
I want you to, that's why I want you to have protein shakes there ready to go. Okay. I want you to drink lots of water also. And the water, when you drink it, yes, there might be some blood there. It's okay. If you have some issues with nausea, we will manage that. But more fluids, the better. Water's the vitality of life, right? So I want you to drink a lot of fluids, not through a straw, okay? But then the last thing is just make sure to avoid those things. No hot foods, no seeds, no nuts, nothing like that. It sounds obvious.
Imagine eat
I know
peanuts or something on the day of.
And you asked, and I'll finish up. You asked one question about what's going to be in my mouth. When you open your mouth up the day of surgery, you will see little metal things just coming up a little bit. Where the implant is, there'll be a little cap over the top of it.
Oh.
So expect that. So you'll still see where the implants are.
So like with my tongue, I'll be able to tell that there's something sticking out.
Yep.
Okay.
You'll tell, but you have to promise me that you can bridle the tongue and not go searching too much, because then you'll knock my sutures out. Then I have to resuture you up the next day, and no one likes me that day. So we want to keep the sutures going. So just try to, as much as possible, tell what's your name again of your Mark. Tell Mark, hey, if I'm messing, just say stop, because a lot of it's unconscious. So, but other than that, I know you're going to do fantastic. We're going to take you through this process. My hope is that we can actually share a lot of this process throughout the week, so we can kind of show your whole experience here. And so I'll actually try to tag you. This is actually on Facebook. I'll tag, if you friend request me, I'll make it. So
I did your Hendricks one.
Yes.
As well as the Dental. I didn't know which one.
So I'll accept that, and then I can tag you and stuff, and then your family that's all around the world, sounds like your daughter in California, we'll make sure that she gets an alert every time we go live, and especially the day that we give you your new teeth. So
yeah, definitely.
But I wish I could hug you. We're not supposed to yet. But there'll come a time when I'll throw my arms around you again. I still have one more round. And then maybe that'll make me less scary to hug people. But I'm a big hugger. I love,
we are too.
I'm an affectionate guy.
Where I work out with the company that I work for, we get tested weekly anyway. So like we know that we're good. And we are now, they're giving us access to the vaccines as well because of what we do. So I'll be getting my.
Awesome.
Yeah.
Well, I can't tell you how much I appreciate this. Hopefully that it's been good for the audience too. Hopefully got some good comments. Any other questions that you think would be useful?
I pretty much asked the ones, and then there were people that asked questions, but then you would go and answer them.
Right, he's really good at doing that. Yeah.
Okay. Well, good.
There's lots of people that are supporting you, telling you thank you for sharing your story. I want to know that
thank
both of your
you.
kids are on here. We reached out to you. We answered the questions about eating. We talked a lot about water picks. There was lots of questions about water picks. We went into that. More thank yous.
Awesome.
You know, at the end of the day, like you sharing your story gives people the courage, to do the same, and also the hope. Like, the one thing I want to take away is that 5 years ago you said this could never happen, and then even last year it seemed like it probably wasn't going to happen. but then life changes, and it's like never say never, because if you keep a positive attitude, which I know you have, I see that in you. That's why I like being around you. I don't always do an interview like this on everybody, because there's some people I enjoy being with, and I love your energy. I love how positive you are.
Thank
And
you.
that's probably why you're here today, is because like you're just good. You're a good person.
Thank you.
And I think that I get emotional here, but like I just don't think it's just chance that that everything's come together for you. And I'd like to believe that as you move forward to the next chapter, that that this will be exactly what you need to launch you forward to do everything you ever hoped for, because you're still so young. You know, you have so much life to live. You have so many pictures to take. You have so many heartbeats, and you know, we got to live every day to the fullest, because we never know if tomorrow comes, right?
Yeah, I mean,
And so,
when I was in that time of my life, I almost died. I was in the hospital for like 3 months, you know, because I was just so messed up. And to think that I am where I'm at now, you know, I don't have time to think negative. I can't concentrate on that. You know, I've spent so long thinking the worst. I had to change that. I have to change that. And I have to keep thinking, you know, no matter how many I still get speed bumps here and there. You know,
yes, we all
stuff
do.
happens, you
We all do.
know, but I can't let that have me reset. You know, if anything, get back up, dust yourself off, and let's keep going, you know. And I think this is why I'm here now and able to do this for myself, because in me changing my character, changing who I am, and becoming a better person has allowed me to meet people like my friend Mark, for example, whom I can't say it enough. I wouldn't have been able to do this without him, you know. And you don't just meet people like that out of the blue.
Yeah.
I feel like you have to be doing something good for God or whoever you believe in. You know, I believe in God, you know.
I do too.
For God to put those people in you
Yeah.
have to be doing good to get good. You know, so I'm obviously doing something good, and he's happy with me that he's allowing these people to come into my life as a blessing to my life.
Awesome.
You know, and allowing me to take care of this. This is something I never thought I'd be able to do.
Well, I know our audience, and I know people out there, they appreciate your courage and letting us sit together and go through really personal stuff. But I know that you're going to, over the next year, 2 years, that this video actually is going to do awesome, because they're going to resonate with what's going on in your life. Everything you tell me, like, it's resonated with me. It's going to resonate more on YouTube, on Facebook. And so I just want to just say thank you for them. And I'm excited to be able to start this journey. So stay tuned. We'll do more videos as we go through this process.
Definitely.
And
I mean, if it can help anybody, me watching these videos that you had helped me.
Good.
Help me relate. You know, help me. The one that I told you about that you did for Mother's Day, for example.
Mm-hmm.
You know, I related to those, and it made me feel like this is possible. So if I can be that for somebody else that's gone through what I've gone through, and know maybe there is a light at the end of the tunnel.
Yes.
You know, I know it seems rough right now, and maybe seems impossible right now, but as you progress, as you grow, as you do better, these things become accessible, you know.
You sure sound like a coach to me. I'm saying the beginnings of a coach here.
Oh, stop.
You're going to be coaching people that you want, whether it's professionally or just in your life. But I can tell, I really believe you're going to do a lot of good.
Yeah,
because
I mean,
you have that mindset.
You know,
So.
I'm not always talking about this to everybody, but if this can help one person to let them know you can.
Oh, it will.
I mean,
I know it will.
I'm all for it.
But thank you so much. I sure appreciate you.
Thank you for having me.
We'll go ahead and sign off here. That's a wrap for today. I'll hit this over here, I guess. He's saying I should hit this. Okay.